Thank you, Director Sir, for inviting me here today. It is not my first time coming to the Judicial Academy, and I think many of you are familiar with me. And I also see very many familiar faces, so I feel comfortable. Usually talking in front of a big group of people tend to get anxious, but now I feel, since we have interacted so much more, I feel that this should be a forum, this should be an opportunity where all of us work together, understand the concept of mental health in relation to both the JJ Act as well as the POCSO Act. And having said this, I thought I will speak a little differently this time, because I've had 1 or 2 sessions before, and I have spoken to many judicial officers also. What can we expect out of children based on their developmental aspects? Because as part of a multidisciplinary team, at one side there is the forensics, the law, legal aspects of it. I assume most of you are from social welfare and child care institutes. So interact. I being from the clinical background, where you bring the child for medical examination of the child, whether sexual abuse has taken place or how much of the impact of the abuse is there on the child. So I'm hoping that this will still be a very interactive session, although the hall is very, very big. Okay, so we'll start off with a small activity. So before that, I just want to tell you the objectives of the program. So one is basically to sensitize everyone. On a daily basis. Some of you in the court, right? So we know, and you've been a child before, so you know what it is to be a child, right? And we'll just put in some more little bit of technical details so that it's not such a technical session as such, but it makes you aware so that we are sensitive to that, and taking that knowledge, we are able to interact with the children in particular ways. And we'll talk a little bit about understanding child sexual abuse, and then it will build more on rehabilitation, because I think the larger group here is also interested in whether the child is going to get better, be it a child in need of protection, care and protection, or a child in conflict with law. So before this, I want you all to just go back. Okay? So let's take 2 minutes and think, what is your earliest childhood memory? Just go back. As what is the earliest that you can remember? What age is that? What were you doing? Any volunteers? What can you remember? Alex?
I remember running around.
With
my brother. I have a little brother, so I thought running around in the fields with my brother, just playing hide and seek and catch and chase and something like that.
So more like a carefree memory, a happy memory.
Yes, sir.
So, anything striking? If no one is there, I'll volunteer. My earliest memory is, I think I was around 2.5 when I first joined school. I'm 40 plus now, so just imagine I can still remember that. And that memory was going to school, but not wanting to go to school and crying. Right? So probably that was traumatic for me. That's why I remember that. I said that I didn't want to go to school. I remember somebody was carrying me, and somebody gave me a packet of titaura. I remember throwing the titaura in the drain because I didn't want to go to school and I didn't want anything to do with school. So now just imagine. Now I want to, although you didn't want to share your memory, now I'm wondering how many, I just want you to raise your hands. How many of you remembered a happy memory? Like Alex? Right? And how many of you remembered a slightly unhappy memory? Right? So, almost 5 of us have some sort of traumatic memory, no? We didn't have to go through child abuse, or maybe you are not revealing it right now, but when I have also been interacting with children in the hospitals, okay, when we talk to them, it seems trauma is not only a big thing. We've come here to talk about POCSO, we've come here to talk about a big, thing like abuse, which is considered only second to murder. Okay, the trauma that somebody murder, the very core of the person. So when a person is an adult, you're able to understand so many things going on. But when you're a child, when somebody is doing something to you, you may not know what exactly it is, but you still know that it is something wrong, right? So we carry with us both pleasant as well as unpleasant memories. Now, I won't ask those of you who raised your hand, that a traumatic memory, it was a negative experience. How do you cope with that even now? Or how did you cope with it when you were a child? I grew up at that age where parents used to beat us also. Now parents are not beating, not supposed to beat. But how many of you got beaten up? Majority of us, right? पिटाई खाँदाखेरि तपाईले कसरी ह्यान्डल गर्नुभयो? आफूलाई कसरी कोप गर्नुभयो त्यो सिचुएसनमा? रिस उठ्यो कि उठेन? मन दुख्यो कि दुखेन? कति रोनु भयो? म त हिक गर्दै उठ्दै सुतेको नि याद छ। तपाईलाई याद त्यस्तो भयो कि भएन? Right? So, what it means that we go through emotions even when you are a small child. Whether you know what you are experiencing or not, when something is happening which is wrong, you can experience that. Right? So, what it means is that as we move ahead in life, we learn no. Do. And you're fine right now or you're not fine, even after getting beat up. I think I'm fine. Most of you must be fine. Right? So what it means is that हामीले संघर्ष गर्यो नि त्यति बेला, पिटाई खायो, गाली गर्यो, हैन, तर we learned how to cope with it. But if you got beat up, someone saw you getting beat up, and maybe if your father beat you, your mother came and said कि okay हुँदैन, हैन, भोलि म मिठाई किनिदिन्छु or something like that. अब नरुयो भने आँखा सुनिन्छ. I remember my mom telling me भोलि स्कुल जानुपर्छ, हैन, आँखा सुनिन्छ. So, but what about abuse? When you are not able to tell others, how do you cope with that? Right? So I want you all to think about that. That many a times what happens is that we are not able to tell those things. Okay? So this was just an experience for you to go back to both happy memories as well as somewhat sad memories. Okay? So memory I spent a lot of time talking about, so that we look through these eyes, through these experiences, as we understand children, as we help children to cope with problems in whatever role that we are, taking care of, be it a judge in the courtroom, interviewing children, as a counselor, as a professional, when you are working with children. Because we are all busy, we all have 100 things to do at home, but when we are with children, I hope that you take this sensitivity with you. I also want you to be aware of your own feelings. How you feel is how you will behave with someone else. So if you feel from a place not as bichara yo, as opposed to, oh, this person went through this and is still doing okay or is trying their best to do okay, then we speak from a place of empathy. We put ourselves in somebody else's shoes. We are not in a one-up position. We are at the same level when we are talking to the child or interacting with the child. Okay? So instead of saying bichara, we need to look at the positives that the child has brought, the strengths that this child still has, or the young person who is there sitting in front of us. Okay? So at the same time, I want you all to remember, Alex, do you remember in detail you running around with your brother?
Not really, just vividly, ma'am.
Right, so unless it is a traumatic situation also, when you are growing up, you are not cognitively, brain development develop, so memories impact. Now I'll tell you, I'll ask you, so I'll put you in the spot. Do you remember what you ate for dinner on 12th of October?
I do not.
So, see, as adults, our brain develop bhaisake. But can we remember in detail? Right? So that is what is important. When we bring in children, we bring in adults also. This may not be such an eventful thing, so sir cannot remember. Now think back, remember unless it was 12th was my brother-in-law's birthday, so I remember what I ate. So our memories are dependent on the situations around. So if there is an event that has happened, then we remember a little more clearly. But again, if it is something bad happening to us, maybe we are not able to process all the information because the feelings overwhelm us. If I am very happy, also I may not be aware of all the other people around me. If I am very sad also, I may not be able to do that. Right? So what it means is that memories, as when we call them in court as witnesses also, our memories get impacted by various things. Suppose some of us have travelled from Soren, I think sir came yesterday, Ola. That's why others haven't come here. But if I had to leave early in the morning, program ma आइपुग्दाखेरि भोकै आइपुगिरहेको बेलामा my thing will be कि कहिले चाहिँ छिटो गरेर खाऊँ भनेर हैन सो के हुन्छ अनि त प्रेजेन्टरले जे कुरा गर्नु हुँदैछ त्यो स्पष्टसँगले मेमोरी फर्ममै हुँदैन मेमोरी राम्रो गरेर फर्म भएन भने हामीले के चाहिँ निकाल्नु बादमा ओके सो memories can get impacted because of various things. So with that we'll look at children now and how they develop. Okay, so here again a little more of interaction. I want you all to, we will discuss more on what are children's physical, social, speech, language, emotional and cognitive needs, and alikiti I'll focus a little bit on the implications ke huncha kinabhane this is a mixed group, so I didn't want to focus too much on that. I've been given the task of actually a broad topic like child psychology. अब यो 1 घण्टामा तपाईहरुलाई सिकाउने कुरा हैन मैले 7 वर्ष लिएर सिकेको कुरा how can I condense that in 1 minute 1 hour was my challenge. But in any case we've all been children. अघि मैले भनिहाले तपाईहरुलाई first bubble मा तपाईले physical देख्नुहुन्छ. So in terms of physical, can you think के चाहिँ changes आउँछ होला development मा? Height.
The loading of shoulders in heels.
Sorry?
Loading of shoulders. Voice.
एकै दिनमा? दुई वर्षमा? No. So it is a continuum नि त. So physical development as we start the बोल्नु पनि बुझ्नु पनि सक्थेन, we were just a lump, हैन? Crying for food, being somebody, helping us. So physical development मा नै हेर्नुस् त first year देखि around 2-3 years सम्म चाहिँ एकदमै rapid development हुन्छ नि, हैन ऊ भन्नु नसक्ने त्यो 2-3 वर्षमा त्यहाँनी हामी वी हेभ मोटर मुभमेन्ट हिँड्नु सक्छ हामी हैन उठ्नु सक्छ पहिला त नेक होल्डिङ नै हुँदैन हैन बस्नु सक्छ त्यहाँनी हिँड्नु सक्छ राइट सो नाउ व्हेन वी थिंक अबाउट दिस जस्ट इमेजिन नाउ आई वान्ट यू टु थिंक अबाउट इट इन टर्म्स अफ when an abuse happens along the developmental period. Okay, so by 3-4 years children will be at least talking in short sentences and they will be running around, हैन. But now if you look at social development भनेको के हो? Our interaction with each other, not only with myself. So that also begins right from childhood, no? अब जब तपाई जन्मिनुहुन्छ जब तपाई भोक लागेर रुनुहुन्छ त्यति बेला there has been theories of attachment theory भनेर छ. Okay, many theories have been there कि if your needs are met immediately that may have an effect on your temperament भन्छ या personality स्वभावमा असर पर्छ. Okay, so suppose तपाई रुइराको छ हैन पट्टी गरिरहनु भएको छ चिसो लागिराको छ भोक पनि लागिराको छ रुइराको छ but you're crying but nobody is responding to you or responding very late. That also seems to have an effect. Okay, we have what we call as a reactive attachment theory bhन्छ त्यसलाई. So whether the mother was cuddling the child or not, was there warmth? There have been studies which have been done. जब उहाँहरूले चाहिँ मंकीजहरुमा रिसस मंकीजहरु चाहिँ मोस्ट लाइक ह्युमन्स भनेर टाढो आमाकोबाट टाढो राखेर आमाकोबाट छेउमा राखेर बिकज इट्स इनह्युमन टु सेपरेट ह्युमन बेबीज हैन. सो मंकीज जसको पनि नानीहरु आमाहरु थिएन उहाँहरूलाई त्यो गर्दाखेरि सो वार्मथ वाज सो इम्पोर्टेन्ट. जस्ट व्हाई डु वी से कि ब्रेस्ट फिडिङ पनि 6 महिनासम्म गर्नुपर्छ, नट ओन्ली फर द benefits of the breast milk but also there should be attachment, the warmth of the mother and the child. So there is a big whole lot of aspects behind why we say ki children have to have warmth, mother child connection र bonding हुनु पर्यो नि. त्यो bondingले गर्दाखेरि चाहिँ हामीहरु अर्कासँग bond गर्न सक्छ नि अलिकति ठुलो भएर, बुझ्नु हुँदैछ? So त्यसमा now when you look at it through as we grow older then we send पहिला नानीहरु they don't know parents from somebody else हैन आमा बाउको हो त चिन्दैन and बिस्तारमा देखेर अलिक चिन्नु थाल्छ. then अलिकति ठुलो भएपछि we know who is mother, who is father, who is a stranger, right? So then we know who to shy away from and who to go close to. So all that is related to our social development, बुझ्नु हुँदैछ? so त्यहाँदेखि नर्सरीमा गएपछि त्यहाँदेखि कतिजना रुनु भयो म जस्तो घरबाट स्कुल जान्दिन भनेर. that is some sort of separation anxiety, some sort of I don't want to separate from my warm people at home. I don't know where I'm going into this big bad world, हैन. so त्यति बेला as then you make friends then you start idolizing your teacher, हैन. त्यति बेला सानोमा टिचरले भनेकै राइट, आमा बाउले भनेको त सबै हैन टिचरले त ए भन्यो ए नै हो हैन, even if it is wrong. so then you start having some sort of other relationships with others. त्यहाँदेखि बिस्तारमा ठुलो हुँदै गएपछि साथीहरु बनाउँदै जान्छ. and I'll focus a little bit on the adolescent age, हैन, social development मा चाहिँ त्यति बेला then साथीहरु नै राइट हो नि, पेरेन्ट्सहरु चाहिँ रङ हो. तपाई त के जान्दैन कति जेनेरेसन ग्याप भएको मान्छेहरु हैन. so whatever your friend says is good and right. so see how we change, हैन, even with our social interactions. अब यो हुँदै गर्दाखेरि चाहिँ the important thing about embedded within social, I want to just talk little bit about हाम्रो आफ्नो individual growth. How many of you will be able to think and say, oh, these are my good qualities? Okay, again Alex, I'll put you in the spot, हैन. Tell me 2 good qualities that you have.
I think I'm creative.
Creative.
Good with children.
He is good with children. Tell me 2 bad qualities.
And I tend to speak more.
अब हेर्नुस् त 2 good qualities भन्दा he came up but it was a little slower, अलिकति ग्याप थियो नि दुईटा bad quality भन्ने बित्तिकै what did he say? He jumped and he told about his bad qualities. Lot of times social development, what it does is that what others tell us, okay, is usually ingrained in us. So हाम्रो आफ्नो self esteem भन्छ नि, हामी आफैले आफ्नो बारेमा के सोच्छ, पोजिटिभ सोच्छ कि अलिकति नेगेटिभ सोच्छ कि के गर्नुहुन्छ तपाईहरुले. So this is a moment of self reflection. Okay, that are you pulling yourself down or are you the one lifting yourself up? Right? So based on your childhood experiences also, based on any kind of, let's say, abuse, forget sexual abuse. If my father is a strict father who is always saying, no, you have to do it like this, you have to do this, हैन? त्यस्तो भयो भने we carry those messages with us. So the impact when it happens from a child sexual abuse perspective, the impact on your own self is so much more. And plus, one thing which we will discuss a little more in detail is also about our own sexuality and our sexual maybe sometimes identification. Katisana chai because of the sexual abuse that they have gone through, what happens is that afno sexual identity ma ne confusion huncha ki, you know, and some of you may be aware, some of you may be working with children with abuse. I work a lot with abuse. Many young girls and boys now I have seen, they are not able to form normal sexual relationships because they have such a negative experience because of the touch that they have felt, you know, when they were children. Okay. So then language development, we have touched on that alikiti agi nai ki एक दुई वर्षसम्म चाहिँ आमा पापा टाटा भन्दै गरेको त हुन्छ, तर तपाईले याद गर्नुभएको छ एउटा कुरा, भन्नुभन्दा अगाडि हामीले बुझ्नु थाल्छ नि, यता हेर हैन, टाटा गर भन्दाखेरि children can wave but they may not be able to verbalize. So our understanding जुन चाहिँ हाम्रो receptive language हुन्छ त्यो चाहिँ first develop हुन्छ, त्यसको आधारमा चाहिँ त्यहाँदेखि हामीहरुले बोल्न सक्छ, बातचित गर्न सक्छ. Okay, so one thing that I have been noticing in my experience recently is that I think as we are becoming more advanced in technology, we are interacting less with the children. So now children are speaking late, socializing late. Also because I think nuclear families, पहिला त हैन काका मामा सबैजना हामी जोइन्ट फ्यामिलीमा बसेर नेबरहुडमा पनि त्यो हुन्थ्यो, भेटघाट हुन्थ्यो. तर अहिले न्युक्लियर फ्यामिली हुनाले गर्दाखेरि मदर अल्सो वर्किङ, फादर अल्सो वर्किङ, so children are not getting an opportunity to interact. So they are showing some signs of delay in their language and socialization. So many children are being brought to hospital with suspicion of autism भनेर सुन्नु भएको हैन? I think you all have had a presentation on autism just last month. Okay, so in autism what is it that children are not able to socialize, maintain eye contact, talk, communicate, you know, they are immersed within themselves. So त्यसले गर्दाखेरि a lot of times socialization has an impact on whether our language is also developed, हैन? कि आमा बाउले बातै मारेन, मलाई सिकाएन भने, बुझाएन भने म कसरी बोल्नु, हैन? So त्योमा चाहिँ प्रब्लम आउन थालेको छ. Now the other thing is the cognitive is a slightly more technical term, but it is to do with anything that the brain does, हैन? So if you think of cognitive development, I already gave you a hint. बुझ्ने शक्ति पनि cognition नै हो, हैन? त्यो बुझेर, I asked Alex a question, I asked Sir a question, उहाँले बुझेर then they responded to me. That is a functioning of the higher cognitive function only. कि ए यसले यो सोध्दै रहेछ है, यसको जवाब चाहिँ यो हुनुपर्छ है भनेर छिटो छिटो उहाँले जवाब दिनुभयो नि, हैन? सो त्योमा के आयो? सोचाइ आयो नि, थिंकिङ आयो, हैन? डिसिजन मेकिङ आयो, प्लानिङ आयो, ए म यो कुरा भन्छु, हैन? भनेर सो कग्निसनमा चाहिँ त्यो आउँछ. अब we'll discuss that also a little bit in detail अहिले. And emotion, yeah.
lack of communication गर्दाखेरि autism हुन्छ.
Just a hypothesis.
Yeah, so what I'll say is that there is a delay, okay? There is a delay in language and distinct development, but that is not autism. Because once we train the child, once we train the parents to interact with the child, बुझ्नुभयो? जब हामीले एउटा ट्रेनिङ स्केड्युल बनाउँछ, नानी आमासँग इन्टरेक्सन टाइम निकालेर बातचित गरेपछि त्यो कम्युनिकेसनमा देन दे क्यान कभर इट अप. बुझ्नुभयो? सो अटिजममा चाहिँ के हुन्छ? Only after great repeated training, they may be able to communicate their needs, they may be able to function on a okay basis, but they may not be having a normal social interaction like, you know so many social rules, no? अब यहाँ आउँदाखेरि there was an introduction, there was a welcome, all these things तपाईं अब साथीहरूलाई भेट्दाखेरि you will shake their hand or you will hug them. But with officers or हाम्रो seniors, we do namaste. So those are all social graces and etiquettes also that we learn. So that is also part of social development. So that त्यो finer nuances चाहिँ जुन चाहिँ अब मैले अहिले भर्खर भने हैन, त्यो चाहिँ maybe in autism even after great training that might not be there. It might be अब train गरेर, but you'll see autistic नानीहरु अलिकति के हुन्छ, हामीले gruff भन्छ नि इंग्लिशमा, अलिकति के भन्छ, rough खालके के आउँछ बस्छ बात मार्छ तर they will be little bit within themselves only. You will somehow even higher functioning autism मा पनि तपाईले चाल पाउँछ कि उ चाहिँ ए अलिकति अप्ठ्यारो खालके छ है भनेर compared to the other normal. बुझ्नुहुँदैछ? So that we can still train but not to such a large extent. But this very important question that you have put up. Okay? So ट्रेन गरेर हामीले सिकाएर त्यो नानी फेरि नर्मल आफ्नो एजको लेभलमा आउन सक्यो भने then that is not autism. And autismमा then there are other features also, repetitive आफ्नैमा घुमसुम हुन्छ, repetition एउटा पुरा हुन्छ, right? Okay? So then we have emotional त तपाईहरुलाई बुझाउनु परेन होला मैले, हैन? There are so many types of emotions that we have, हैन? So some positive like happiness, excitement, motivation, enthusiasm, right? Then we have negative ones, anger, frustration, aggression. त्यो सबै त सानोदेखि नै हामीले सिकेर आएकै कुरा हो. र one thing is that कि brain development मा पनि हेर्नु भयो भने the emotional part of the brain चाहिँ first develop हुन्छ. त्यहाँदेखि मात्रै यो हाम्रो prefrontal भन्छ नि यो ठिकै यहाँ माथि त्यो चाहिँ बादमा around between 16 to 21 years there's a full maturity. बुझ्नुभयो? So why that is भन्दाखेरि चाहिँ this part of the brain develops much later. So we are able to अब जस्तो पहिला how many of you believed अब I don't know सानोमा that Santa Claus is really going to come, Christmas father आएर गिफ्ट छोडिदिन्छ भनेर. I don't know how many of you all had that, right? या के भन्छ बाहिरबाट अब I don't know how many of you are भुटिया here, but our grandmothers जस्तै कि प्यातेम आउँछ सास भयो भने घरभित्र बस्छ प्यातेम आएर चाहिँ टिपेर लान्छ के नानीहरुलाई. So we really believe that something like that is going to come. So that is an example of your higher cognitive development that बादमा बुझ्यो नि कि ए त्यस्तो खाले हैन रहेछ सासमा बाहिर नखेलोस् भनेर हैन उनीहरुले हामीलाई घरभित्र थुन्नुको लागि पो भनेको रहेछ यस्तो भनेर, right? So the emotional part of the brain develops fast. So many a times in child sexual abuse, what happens is that children are aware, उनीहरुलाई feeling को याद हुन्छ तर they cannot express because उनीहरुको brain नै त्यति एउटा functioning भएको हुँदैन. बुझ्नुभयो? To be able to even express what they have gone through. So sometimes के भयो भनेर हामीले बारम्बार सोध्यो भने पनि हाम्रोमा उनीहरुको maybe cognitive capacity नै नहोला, त्यसले गर्दाखेरि चाहिँ they will not be able to answer your questions. Okay? So now I'll just focus on between I'll say a little bit till age 3, किनभने age 3 को बादमा then we'll how it impacts the sexual abuse process itself impacts भनेर त्यसमा चाहिँ we'll focus a little more because these things I don't know whether you all were here, but I think normal child development also I think you all had a presentation on that. तपाईहरुले सिकायो हैन normal assessment गर्नु सिकायो कि सिकाइन लास्ट प्रेजेन्टेसनमा. So you all don't know. Okay, but anyways, speech or language ma we'll focus, because here when we are talking about counseling or therapy or being a witness in the court, we are talking only about भन्नु सक्छ कि सक्दैन, बुझ्नु सक्छ कि सक्दैन, हो कि हैन? So when you look at normal speech and language development, between 10 to 14 months मा चाहिँ नानीले अलिकति एक दुई तीनवटा वर्डहरु चाहिँ भन्दै गरेको हुनु पर्यो. At least it should be like mama, papa, हैन, or biscuit or chocolate or something like that. Then between एक वर्ष आदिदेखि के भन्छ 2.5 वर्षसम्म चाहिँ they should be able to at least say 3 or 4 meaningful words. Okay. After age 3, then there's a lot of words, lot of language, right? So pete बोल्नु थाल्छ नि, त्यति बेला हैन तोते बोली बोल्दै गरेको हुन्छ नानीहरुले, तर you find them cute but they'll be talking a lot, right? And as the child after 5-6 years त त्यहाँदेखि राम्रो गरेर बोल्नु थाल्छ, हैन? So if you are asking, so now this is what I want you to remember, that when you are interacting with children who are below 3, it might be useless to even ask them. Even 3 to 5 years, they may be able to say a few things, but not everything. Okay? So, in terms of social development, in the lens of again child development and sexual abuse, by 10 months the child knows who is family member and who is a stranger. So, body language ले देख्नुहुन्छ नि, नानी आइज भन्दाखेरि सबैकोमा जान्छ नानी? जान्दैन नि. So त्यति बेला हेर्नुस् त, you know who is a stranger and your body reacts emotionally that I shouldn't go to this person भनेर त्यो चाहिँ नानीहरुकोमा by 10 months भइसक्छ. Okay? By 3 years, even if you don't teach them too much, children know no, you're not supposed to go to toilet in front of everyone or open your clothes in front of everyone, right? So they have that kind of a sense, okay? And they're a little ashamed about के भन्छ, लाज लाग्छ हैन उनीहरुलाई. So when you look at अब हामीले जुन चाहिँ brain development, cognitive especially development को बारेमा कुरा गर्यौं, त्यति बेला चाहिँ 3 वर्षसम्म चाहिँ 1 वर्षदेखि 2 वर्षसम्म बोल्नु सकेन भने भए पनि उहाँहरुले एक्सप्रेस त गर्न सक्छ नि. भोक लाग्यो भने रुन्छ, चिसो लाग्यो भने अलिकति अनुहार बनाउन सक्छ, छम बोलायो भने यसो तान्यो भने, if they don't want to come they will resist, no, अलिकति त बडीले यसरी अरठे पार्छ नि हैन. So children will be able to at least express in terms of their body language and their gestures even if they are not able to speak. By 3 years they are able to speak, and then this thing called हामीले psychology मा चाहिँ there's one term called object permanence, कि मेरो आमा छ, मेरो आमा अफिस गयो भने फर्केर आउँछ भनेर चाहिँ तपाईहरुलाई एहसास भयो. मैले अब now when we say that there is something here, कुकु हा हा भन्ने नानीहरुसँग कति जनाले खेल्नु भएको छ लुकेर हैन? So that is object permanence, that you know that that person is hiding somewhere but that person will come back, right? But it is still very grey around 3 years age, that they don't know whether this जसले चाहिँ perpetrator चाहिँ छ यिनै छ जस्तो लाग्न सक्छ, बुझ्नुभयो? So they don't know whether that perpetrator has gone or not. So they may think that the perpetrator चाहिँ अहिले यिनै छ, फेरि फर्केर आउँछ, because they know that something has been violated in their body, बुझ्नुहुँदैछ? So त्यसले गर्दा नै they may not be able to speak to you, but that anxiety जुन चाहिँ हुन्छ, डर जुन चाहिँ बसेको हुन्छ, त्यो चाहिँ नानीहरुमा बस्न सक्छ त्यो सानो एज देखि नै. And as 3 years देखि बेसी भएपछि, अब 3, 4, 5 years भएपछि चाहिँ जन ज्ञान आएपछि ए यहाँबाट गयो मतलब अहिले छैन यहाँ, unless that person is right appears again, then that anxiety comes up, right? So that is there, but the brain is still not developed. त्यति बेला चाहिँ हामीले के भन्छ, उनीहरु egocentric हुन्छ कि they will only know about what they are feeling. So they will usually have that feeling कि मलाई जे हुन्छ अहिले मलाई जे हुँदैछ त्यो चाहिँ सबैजनालाई अहिले नै हुँदैछ. So त्यसले गर्दा म लडेर रुयो भने अरूहरु चाहिँ किन नरुएको, उनीहरुलाई चाहिँ किन नदुखेको हैन? So त्यो भन्नु हुन्छ. Okay, so that is called egocentricity, where you feel that what you experience is being experienced by everyone, and as after 5 years, 6 years, then you start to gain that knowledge that the world doesn't revolve around me. मलाई जे हुन्छ सबैलाई हुँदैन भनेर ओके सो between even 5-6 years also children don't know when you are being abused and abuse doesn't I don't know whether you have been clarified or not that when we talk about child sexual abuse it does not only mean penetration just fondling the breasts or the genital area or anything is also or showing videos filming the private parts is also a violation okay so sexual abuse has various degrees so when we think of abuse we only I hope you are not only thinking of rape right so especially now if you are taking a video the child doesn't have any idea only no if you are nappy त फेरिरहेको नै हुन्छ तर nappy फेर्दा फेर्दा अरु कसैले हैन मामा काका काकीहरुले के यसो चलाइदियो भने खेलाइदियो भने स्टिमुलेट गरिदियो भने हैन so those are the things that we need to be aware of so they don't know what whether they are getting violated or not and even younger children even if there is penetration also sometimes they don't know that it is right or wrong right so they will not be able to express it further okay so now we'll just look at is it clear तपाईहरुलाई ठुलो पढ्न सक्नु हुँदैछ है so now if you see I have just on the first column I have put in age okay so age then second column whether they are able to tell you about whether they have been abused or not okay and third ma chai how do we know indirectly that they might have been abused बुझ्नु भयो so 0 to 18 months ma as I said language development एकदमै कम्ती भइराको हुन्छ नानीहरुले बोल्नु सक्दैन right अनि so बोल्नु नै सक्दैन and if they can't speak then how do you know that they've been abused so sometimes what happens is a particular mama comes then the child shows little bit of discomfort हैन रुएको जस्तो उले बोक्न जान्दाखेरि बोक्न नगएको जस्तो हैन so if अब त्यसकै आधारमा चाहिँ फेरि अक्युज गर्नु त भएन नि हैन it could be just the way that the child is being held but that is again a warning sign red signal भन्छ नि हामीले then we say when the child is fussier than normal fussy भनेको चाहिँ हैन बेसी रुएको जस्तो हैन न्याङ गरेको जस्तो भन्छ नि नानीहरु अस्ति देखि त के भयो रुएकै छ खाना राम्रो खानु पनि मानेको छैन राम्रो सुत्नु मानेको छैन हैन झगडा पुरा गर्दैछ आमासित झिन्झट मान्दैछ ओके सो त्यो भएपछि चाहिँ now there is something so actually when you look at it there is any बदलाव ओके from the normal जुन चाहिँ नानीहरुको everyday life छ बर्ताव छ सधैं नरुने शान्तसँगले सुत्ने मजाले खाना खाने नानी चाहिँ अहिले ज्यादा रुँदैछ के हो भने if not physically ill something is wrong with the child no so we need to investigate a little further especially nappy change गर्दाखेरि अप्ठ्यारो मान्दैछ रुँदैछ भने that could also be a sign okay so all things put together right फेरि त्यो मात्रै भएर अर्कालाई हैन हामीले अक्युज गर्नु पनि भएन and occasionally what young children may do is also do some gestures which are indicative that somebody may have touched them they might start stimulating themselves बुझ्नु भयो so private parts मा हात लगाकै गर्यो भने या if they are rubbing their private parts on something else okay so that can also be a sign so तर अब we know all this तर this can only be said clearly कि if somebody has seen them हैन कि उलाई चाहिँ यस्तो गर्दै गरेको मैले देखे आई विटनेस छ कि को पर्पेट्रेटरले भन्यो कि मैले यस्तो गरे हैन र the other thing is that even young children can have अब पर्पेट्रेटर मा सेक्सुअल के एउटा डिजीज छ भने हैन गोनोरिया व्हाटएभर हैन छ भने नानीहरुमा पनि त्यो एसटीडी लाग्न सक्छ सो हैन फोका जस्तो जेनाइटल वाट्स भन्छ नि त्यो के भन्छ मुसा भन्छ नि हामीले नेपालीमा हो त्यस्तो हैन त्यहाँदेखि if you see any sort of kind of injury जस्तो या any kind of white liquid kind of thing which may be suggestive of sperm or semen okay on examination so then if you look at now अलिकति त्यो भन्दा ठुलो नानीहरु around let's say 1 वर्ष आदि देखि around 3 वर्षसम्म again we already told you हैन we already know that यति बेला पनि नानीहरुले 2-3 शब्द बोल्छ होला त्यो भन्दा अलिकति 4-5 बोल्ला हैन so they may not be able to again report कि मलाई यस्तो भएको छ भनेर right So, but sometimes since they do have some language, they might be able to say about, this is a very English example that I am giving you. And this is a real case. Oh, pee daddy, there's something wrong in the genital area. Okay, while pointing to their genital area. So they may be able to say कि यहाँ आया or यहाँ something like that के भन्नु सक्छ होला उहाँले, अब त्यो भन्दा बेसी नभन्नु सक्ला. The other thing is again, अघि मैले भने नि, like I gave you the birthday example of 12th October. I can remember what I ate because it was a special occasion. So can't remember because it is a normal occasion, right? So, but in younger children, they don't have that cognitive or memory capacity to say कि कहिले भएको थियो. अब यहाँ पिपी काकाले आया भन्नु सक्छ नि, तर कहिले गरेको थियो, भएको थियो कि थिएन, त्यो डिटेलमा कहिले, कुन दिन, कुन जग्गा, त्योहरू चाहिँ केही नानीहरूले भन्नु सक्दैन. They may indicate that there is some sort of violation that has happened. Okay. Big indicator again, अब राइट साइड हेर्नुस् तपाईले इमोसन र बिहेभियरमा हामीले कस्तो चाल पाउँछ. जो चाहिँ पर्पेट्रेटर छ या को छ, धेरैचोटि उहाँले डर लुक्नु खोजेको, उहाँबाट भाग्नुको, उहाँ आउँदाखेरि अलिकति हैन डराएको जस्तो, त्यो काका आउँदैछ भने भागेको हैन, त्यो अलिकति. And again here, like small children, they may mimic the sexual acts. किनभने उनीहरूले, when you know when you are young, टीचर कोले खेलेको छैन सानोमा हैन. 3 वर्ष जति 4 वर्षमा त हामी स्कुल जाइसक्छ नि त हैन. And you know that बाराकुटी खेल्छ, के पकाउने खेल्छ, हो त्यसरी नै. Now children will communicate a lot with the play. So they might mimic, they may show you sexual activities which you haven't taught the child this, that means something is definitely wrong. अब नसिकाको कुराहरू with their bodies if they start doing, right? And they may not only show you, but they may do with other children. They may lie on top of another child, they may pull that child and try to fondle their private parts maybe, or they may show it with the बुढियाहरू खेल्छ नि नानीहरूले, त्यति बेला that play will be somewhat sexual kind of a play. Okay, so that will be an indication. Another important thing is that उनीहरूले regressive behavior देखाउँछ. Regression भनेको के हो, जुन अब स्टेटमा पुगेको छ त्यो भन्दा फेरि ब्याक सर्नु. जसरी अब टोयलेट ट्रेन भइसकेको नानी हैन, आफै सुसो आयो भन्दै गरेको नानी चाहिँ सडनली दे स्टार्ट वेटिङ इन देयर प्यान्ट्स हैन. इटिङ सबै आफै हातले खानु थालिसकेको चाहिँ नाउ दे आर अगेन नट इटिङ. जुन चाहिँ ल्याङ्ग्वेज बोल्दै थियो त्यसमा पनि अलिकति बोल्ने कम्ती भयो. सो जुन डेभलपमेन्ट भइसकेको छ त्यसमा ब्याक सर्नुलाई चाहिँ हामीले रिग्रेसन भन्छ. ओके, सो अगेन इन दिस एज ओन्ली, सो अगेन इन दिस एज ग्रुप 3 वर्षसम्म मेनी चिल्ड्रेन डोन्ट नो राइट के हो रङ के हो, उसले चलायो चलाएन हैन, त्यो उनीहरूले याद छैन कि याद हुँदैन, राइट. त्यहाँदेखि अगेन हियरमा जस्ट लाइक इन यङ्गर चिल्ड्रेन वी निड टु सब्सटेन्सिएट. किनभने अब उसले आया भन्दाखेरि मेबी he did some बदमास and the काका gave him one thumb on the butt हैन. सो काकाले आया मिन्स बममा कुटेको पनि हुनसक्छ नि. इट माइट नट बी a sexual act itself, right? So we need to again verify. बुझ्नुहुँदैछ? देन कसरी भेरिफाई गर्ने, अगेन अलिकति यसो सोधेर यसो हेरेर हैन, एकैचोटि अक्युज नगरेर. तर त्यहाँदेखि चाहिँ अगेन एनी सेक्सुअली ट्रान्समिटेड डिजिजेस छ के भन्छ, न्यापीमा के पायो पाएन हैन, कोही बेला अब खुनहरू पनि हुनसक्छ. त्यहाँदेखि अगेन यो उमेरको नानीहरूमा चाहिँ दे मे ह्याभ स्लिप डिस्टर्बेन्सेस अल्सो. ओके, सुत्दै गरेको नानी हैन, अब मजाले सुत्दै गरेको, राम्रो सुत्नु सक्दैन. त्यहाँदेखि अगेन यो चाहिँ दे मे सो इमोसनल बिहेभियर्स, एकदमै बेसी रिसाएको जस्तो, रुएको जस्तो. एन्ड आमासँग या केयर गिभर जोसँग चाहिँ उहाँले सपोर्टिभ लाग्छ उहाँसँग चाहिँ एकदमै टालेर हैन, छोड्नु नमानेको जस्तो. सो all that shows some sort of separation anxiety. Okay, that if I leave my mother or my caregiver, something bad might happen भन्ने एउटा indication हो नि त त्यो. Alright, so now we go on to the slightly older age group. Okay, 3 to 5 years. अब उनीहरुकोमा चाहिँ अलिकति अब हैन बोल्ने शब्दहरू अलिकति बेसी भइसकेको हुन्छ. But they may tell you some things, but सोध्दै जाँदा खै कुनी हौ हैन हौ कुनी के भनेर टोल्लेको जस्तो आई कान्ट रिमेम्बर हैन भनेर भन्नु सक्छ उहाँहरूले एन्ड दे मे बी एबल टु गिभ यु फ्यु डिटेल्स तर अगेन द थट प्रोसेस इज नट सो ग्रेट त्यसले गर्दाखेरि दे मे नट बी एबल टु टेल यु टु द एक्सटेन्ट द्याट यु वान्ट हैन डिटेल्स कहाँ भएको थियो के भएको थियो भन्नु सक्दैन होला तर नाउ जसरी अघि मैले एक्जाम्पल दिएँ त्यो बर्थडेको अगाडि मलाई कमरामा लगेको थियो त्यो बर्थडेको दिनमा काकाले मलाई मिठाई किनेर जङ्गलमा लगेको थियो समथिङ लाइक द्याट यु नो दे मे बी एबल टु से सो अल्दो दे मे नट बी एबल टु टेल यु द डेट एन्ड द टाइम एन्ड अल द्याट दे मे बी एबल टु फिक्स द्याट एपिसोड विथ अनदर इभेन्ट so they may be able to tell you. So when we ask them, that might be helpful. Okay? Sometimes some children are bathenu, they can tell. So it's not to say that they can't tell. So 5 वर्षको नानीसँग कतिजनाले गफ गर्नु भएको छ कतिजनाले त निकै बात मार्छ नि हैन so they may be able to tell you. Okay? So usually हामीले चाहिँ सानो सानो 3 वर्षदेखि 7-8 वर्षको नानीहरुसँग we do a lot of demonstration. So you can use pictures, you can use dolls, all right, so that to show कि के भएको थियो कस्तो गरेको थियो. They may not have the language to do, but they have the ability to mimic and imitate. So त्यसले गर्दाखेरि उनीहरूले demonstrate चाहिँ गर्न सक्छ. बुझ्नुभयो? So that can be one tool that we all can use. All right. Then again, how can you know emotionally or behaviorally? Again, यहाँ चाहिँ कोही बेला यो वर्षको नानीहरु चाहिँ if they don't want to go somewhere, many children say भुँडी दुख्यो हैन so that can be an expression. They may show sexualized play अरु नानीहरुसँग हैन sexual play. Urine गर्दाखेरि they may have pain, okay, and they may have discomfort in the genital region. So again in this age group only many a times they are confused whether he or she हैन नाम चाहिँ चिन्न सक्छ तर केटा हो केटी हो त्यति साह्रो त्यो हुँदैन त्यो चाहिँ तपाईले याद गर्नुपर्छ र स्पेसिफिक बडी पार्ट हामीले सिकाएको छैन भने उनीहरुलाई थाहै हुँदैन नि त ओके सो इफ यु पोइन्ट ओके सो again here although they may be able to tell you some things again we have to substantiate with some physical examination again your sperm STD हैन and the history also becomes important and they may be able to answer your question. So what you can do is you can अब लामो खालको क्वेशन नसोधेर तपाईहरुले पनि short questions चाहिँ सोध्न सक्नुहुन्छ ओके कहाँ गएको थियो हैन although we say कि open ended question सोध्नु भनेर alright open ended you know what it means and I think in some other occasion I have spoken in great detail about types of questions. So types of questions मा चाहिँ yes no answer नभएको चाहिँ open ended question हो नि त हैन alright. So as sometimes with these children you can ask them to draw, ask them to show, हैन ask them to demonstrate कस्तो भएको थियो हैन so they will find those easier than to say कि भन्नु चाहिँ सक्दैन तर देखाएर तपाईहरुले गर्न सक्नुहुन्छ. And important thing is here at this age children know when they are safe and not safe. So we should not be the ones who are giving them secondary trauma भन्छ नि एउटा त अब्युज भइसकेको थियो त्यसको बादमा हामीले गरी भन न भन्दै सोधेर हैन लु भन्यो भने त्यहाँ छिटो यहाँबाट जानु पाउँछ all those kind of things चाहिँ we should avoid because then the child will feel कि I can say anything मैले भन्यो भने चाहिँ त्यहाँदेखि म यहाँबाट जानु पाउने रहेछ है भनेर चाहिँ त्यो दिमागमा लाउन सक्छ नि सो नभएको चीज पनि भन्नु हो भन्न सक्नुहुन्छ सो त्यो चाहिँ तपाईले याद गर्नुपर्छ ओके सो make the child feel comfortable and you know this thing. So in this age group मा चाहिँ कति जना नानीहरु सुतिराको बेलामा तर्सिँदै उठ्ने नाइटमेयर्सहरु त्यस्तोहरु देखिन्छ ओके here again lot of anger aggression रिसाउने झगडा गर्ने झिन्झट मान्ने कति जना चाहिँ घुमसुम के पहिला हाँसेर इन्टर्याक्ट गर्ने नानीहरु चाहिँ विथड्र गर्न थाल्छ नि यसो हेर्दाखेरि पहिला जस्तो छिटो आउँदैन खेल्दैन so there are changes in their behavior so any change which is added or decreased त्यो चाहिँ तपाईले याद गर्नुपर्छ ओके कि सो मैले अघि भने नि जुन चाहिँ नर्मल छ त्योबाट बदलाव भयो भने र त्यो बदलाव 1-2 दिन भयो भने it could be you know some sort of real tummy ache र त्यो भन्दा बेसी भयो भने no explanation then we need to somehow suspect. कति खुसी हुने रिसाउने झिझट मान्ने सो मुडलाई हामीले लेबाइल भन्छ नि त्यो भने चाहिँ छिट्टो मर्क्युरी देख्नु भएको छ तपाईहरुले थर्मोमिटरमा मर्क्युरी हुन्छ नि माथि तल कति छिटो जान्छ हो त्यसरी नै उहाँको मुडहरु चेन्ज जब हुन्छ सो वी से दैट इज लेबाइल मुड साथीहरुसँग झगडा पर्ने आमा बाउलाई अठेरी मान्ने ओके all those things also might be an indication so psychosocial ma problem आउने okay so now when we look at slightly older children 6 देखि 9 वर्षसम्म so now these children have ability to tell you okay they may not have the specific detail अब यो दिन भएको थियो यो तारिख भएको थियो भनेर उनीहरुले भन्नु नसक्ला तर to a large extent they will be able to tell you बुझ्नुभयो but you have to make them feel safe you have to make them feel secure you have to make them feel protected and that you are there हैन for them भनेर चाहिँ तपाईले त्यो फिलिङ जनाउन सक्नु भयो भने चाहिँ उहाँले तपाईलाई भन्नु सक्छ र one thing is that when we are talking about uncomfortable things that have happened to me even if I have the language I might not tell you because of your behavior towards me बुझ्नुभयो सो त्यसले गर्दाखेरि sometimes हामीले उहाँलाई एक्टिभिटी गराउँदै गराउँदै पनि so that they are half distracted and half you know in the conversation and you have to behave as if this is normal that it's okay to tell me okay I am here to help you all right so you have to have little bit of time you can't rush them छिटो छिटो गरेर चाहिँ अब तपाईहरु दुईटा केस हेर्नु छ छिटो छिटो गरौँ भन्दाखेरि हैन हुँदैन नि सो तपाईले त्यतिबेला टाइम दिनु पर्यो and same problems might be there but because these children have some sort of self identity नि यति बेलासम्म त म मेरो चीज भनेर त सानो देखि नै गुडियाहरु मेरो गुडिया कसैलाई छुनु दिन्छु म दिन्दिन नि शेयरिङ आउँछ हैन त्यसको बादमा तर you have your own identity त्यति बेला so that time they will because of the perpetration they might have confusion they might have guilt they might have shame they might be embarrassed हैन so कति जनालाई डर पनि लाग्छ किन many a times perpetrators ले भन्छ नि कसैलाई भन्दियो भने म के गर्दिन्छु किन राम्रो आमालाई मार्दिन्छु बाउलाई मार्दिन्छु कसैलाई नभन्नु तैले नै यस्तो आउनु भनेको थियो भन्छु भन्दाखेरि you know a lot of times what happens we blame the victim also no and that is what the perpetrators and they are adults usually and they are able to manipulate the child okay so that the child doesn't reveal कि उले मलाई यस्तो गरेको थियो भनेर हैन अन्त त्यनी यसमा अगेन द सेम थिङ त्यनी अझै बिहेभियर प्रब्लम्स के आउन सक्छ भन्दा रिसाउनु त्यो गर्नु त त्यो ढाट्नु हैन चोर्नु all these behavior problems जुन चाहिँ हामीले बदमाश भन्छ नि नानीहरु त हैन मोरल भ्याल्युज कम्ती भएको जस्तो देख्छ तर एक्चुअली why do children behave in ways which are against the social norms maybe something happened to them and they are acting out भन्छ हामीले okay in psychological terms कि त्यो अब त्यो भावनात्मक रूपमा त के भइराख्छ they need to vent out release their energy release their frustration anxiety scared feeling fearfulness त्यसले गर्दाखेरि चाहिँ they may show some other types of aggressive behavior okay antisocial behavior भन्छ नि okay so now again in so यो मैले भनिसके कि we need to make them feel comfortable first हैन एकैचोटी आउनु बित्तिकै don't talk about you know the abuse at once you can talk about some neutral topic and then broach the topic okay and so like अघि मैले भनिहाले simultaneous एउटा एक्टिभिटी हामी ड्राइङ गरौँ न कलरिङ गरौँ न ए अन्त यो कस्तो राम्रो कलर कुन कलर हुन्छ यो भन्दै त्यहाँदेखि अर्को गफ गर्दै गर्दै त्यहाँदेखि तपाईले त्यो अब्युज को बारेमा पनि तपाईले you can broach the topics many times these children have other physical symptoms टाउको दुखेको बुढी दुखेको हैन त्यहाँदेखि genital pain भएको त्यो सबै हुन सक्छ अर्को कुरा चाहिँ they may have enuresis भनेको चाहिँ they cannot control their potty हैन so toilet they may just do in their this thing or even you know short and long both okay long is called encopresis and enuresis is the short toilet okay अब 9 to 13 ले त सबैले भन्नु सक्छ हो कि हैन हैन तर भए पनि it is important to make them feel comfortable that you know you are there for them okay and one thing is there now by 8 9 children know, no, I am a girl and I am not supposed to talk about female stuff to men भनेर एउटा हुन्छ हैन. सो त्यसले गर्दा इट इज इम्पोर्टेन्ट कि जब इन्टरभ्यू गर्नुहुन्छ त्यति बेला प्रेफरेबली सेम जेन्डरको छ भने चाहिँ देन दे विल बी एबल टु टेल यु बेटर. ओके. अन्त हियर अगेन what I would like to caution is our first instinct when we know this child may be abused, we try to go and hug the child हैन, यस्तो अङ्गला मार्नु हैन, त्यो एउटा इन्स्टिङ्क्ट आइहाल्छ नि. Refrain from doing that. If you want to do also, first ask, okay, is it okay if I touch you? Because a lot of times what happens is that touch itself is very problematic. It is, for us we may be having good intentions, but for them, because of the touch that they have, every touch may not be perceived. हैन, उनीहरुको हेर्ने नजरमा नै अलिकति बदलाव आइरहेको हुन्छ. त्यसले गर्दाखेरि be careful about that. Not being matter of fact, but at least act as if it is something that, okay, अलिकति तपाईले भन्नु पर्यो कि म यहाँ के कारणले आएको, तपाईलाई यस्तो यस्तो क्वेशन सोध्छु र तपाईले नडराइकिन मलाई जवाफ दिन सक्नुहुन्छ भनेर भन्नुभयो भने त्यहाँदेखि क्वेशनहरु गर्नुस्, ताकि because these children now they are at that level where they are able to understand to quite an extent, and if you normalize the asking questions and receiving answers, then you will get better answers. Okay, they know that something has been done which is wrong, हैन, जुन चाहिँ उहाँलाई नराम्रो भएको छ भनेर उनीहरुलाई याद हुन्छ. त्यसले गर्दाखेरि they may feel discomfort, लाज लागिरहेको हुन्छ. Okay. And again, your questions should not be too long. हैन, त्यहाँ गएपछि त्यहाँ त्यो मान्छेले गरेपछि त्यहाँ तिमीले के गर्यौ, so that question is so long, हैन, त्यो त्यहाँ के भयो त्यहाँदेखि भनेर, even if you want open ended questions. Okay. So, and we need to give certain body cues कि भने encourage गर्नुस् उहाँलाई बातचित मार्ने हैन. So not only verbal cues, non verbal cues are also very important. अब उले के भन्दैछ अपै भनेर अर्कोलाई यस्तो हेर्यो भने you know that it is something strange, so they will not feel comfortable enough to talk. So body language is important. Don't touch them, but lean forward भनेर हैन, maintain eye contact. Okay, अझै भन्नुस् त अनि ए त्यस्तो पो भयो, it was such a difficult हैन, तपाईलाई त्यति बेला सारो परेको थियो है भन्दाखेरि you know that you are reflecting back the feeling also to the child, that and you can reflect back to the child कि अरूहरुलाई पनि यस्तो भयो भने अरूहरु पनि त डराउँथ्यो, अरूहरुलाई नि त एंजाइटी हुन्थ्यो भनेर. If you normalize that abnormal feeling of the abnormal situation, then you are doing good. Okay, so that the child knows that oh, it's okay to feel fearful in this situation नि त, अनि त्यो पनि भयो, अनि नडराउँदाखेरि त abnormal भयो नि हैन भन्नुस् त. Okay, so then reassure them कि ल अब यस्तो त भएछ हैन, I am very sorry it happened, तर अब चाहिँ I will ensure that you will be protected, अब चाहिँ यस्तो नहोस् भनेर के म जति सक्दो अरूहरुलाई पनि. And don't take the sole responsibility again. Okay, because we all have to work as a multidisciplinary team, right? So here what are the behavioral and emotional problems the child may have? Again, lot of अब बुझाकी अलिक बुझ्ने भइसकेपछि त नानीहरुलाई लाज शरम guilt, sometimes a lot of times children blame themselves. Okay, so I'll give you an example. This girl was a little older, okay, but she had already realized by 13. Okay, she came to me when she was around 17, 18. Okay, and वहाँ चाहिँ उता नर्थ पट्टिको हुनुहुँदो रहेछ. अन्त यो बाटोको यस्तो लेबरहरु हुँदैन, उहाँहरूले चाहिँ उलाई फकाएर मिठाई दिएर जंगलमा लाँदा रहेछ. Alright, and she didn't know that it was bad till a long time. When she was in 13, 14, 15, when she was talking to her friends and all about, you children get curious, हैन, त्यहाँदेखि बातचित मार्दै जाँदा त then she realized that मलाई त यस्तो अब्युज भएको रहेछ. अब हेर्नुस् है, उलाई 8-9 वर्षमा भएको, उलाई रियलाइज भयो कहिले 13-14 वर्षमा. Then she started feeling that guilt. त्यसको अगाडि guilt, perpetration was earlier, she was confused at that time, she didn't know मिठाई पाउँदै थियो उले हैन. त्यहाँदेखि 13-14 वर्षदेखि चाहिँ उलाई यति सारो गिल्ट हुन थाल्यो कि छी त्यति मिठाईको लागि, not once not twice, many times, and she was not able to tell her family members also. Okay, And she was feeling very guilty, and so she was having lot of emotional dysregulation भनौँ न हैन, self blame, anger, त्यो सबै भएपछि चाहिँ she needed to pent out that energy. So she came to me around 18 जस्तो थियो होला, यता college, she joined college, after that she was admitted in the hospital. And यो मलाई थाहा थिएन, कसैलाई थाहा थिएन, okay, that this had happened to her. She, you know what symptoms she came with? Cutting of wrists, you know. So बारम्बार उसले चाहिँ हात काट्दा रहेछ नि ब्लेडले हैन. अनि she was admitted to a ward. अनि I was not looking after her at that time, हैन, but somebody, the psychologist who was seeing, who was helping her, she was on leave that day, and I just filled in key. So it is very important, I felt, to ask anybody who is acting out to please assess for sexual abuse. Because then मैले सोध्दै जाँदा, she had no, and then I was the first person in her life whom she had told about, because I made her feel comfortable. I think that's why she was able to open up to me. Okay, because till then, imagine keeping that secret for maybe 10 years, I think, how difficult it must have been. Feeling so alone, feeling guilty, feeling blamed, feeling violated, feeling घिन लागेको, हैन? So there's so much of confusion regarding even her sexual identity that she's now attracted more to girls than to boys, and this is not the first case that I've seen. Okay, so and a similar case had just come few weeks back. So I'm seeing that girl again. She's also elder. She was in a hostel in some other state. त्यहाँको hostel warden ले उलाई त्यस्तो गरेको रहेछ. And in बादमा when she knew about sexual all these, त्यति बेला she did tell her parents. Then it was there's no evidence, के गर्नु हैन? अनि they also felt like अर्को स्टेटमा छ, you know, a lot of legal issues, so they removed the child from that institution, उहाँलाई अर्को स्कुलमा हाल्यो. तर त्यो नानी के भयो, आमा बाउले त, you know, and आमा बाउ is still at a loss. And so that time, psychological first aid, we'll talk about it later, that time it is important, you know, because if we are at least able to help them cope with those feelings at that time, it might have helped them. Because now this young girl who came to me, she also came with self-harm behavior. वहाँ पनि suicide गर्नु 2-3 चोटि खोज्यो, not because of the abuse, but she was going through a hard time. She actually went to Australia to study medicine. सबै कुरा, you know, it became too much for her going to a new place, all that. So she was suicidal in Australia, and she had to be brought back from Australia. Okay. So now what that means is that, look at the long-term ramifications. We'll still talk about that. So what is important is, do please, even if you feel uncomfortable, even if you feel कि उनीहरूले मेरो बारेमा के सोच्छ होला भन्दाखेरि नि, it is important to elicit some sort of history of abuse, because I think there are very many people who are suffering in silence, and they are cutting themselves or they are acting out through various ways. Okay, so that's why it becomes very important. And if we normalize the asking part, then help will come, no? Okay, so they are very self-conscious at that time, I know. So again here 13 to 18 years, यसमा पनि तपाईले डाइरेक्टली सोध्दा हुन्छ हैन, अब डाइरेक्ट डजन्ट मिन तपाईलाई यस्तो भएको थियो भनेर, दैट इज नट डाइरेक्ट हैन. सो क्रिएट अ सीन एन्ड देन आस्क, ए कति जना जब के भन्छ मन दुखेको हुन्छ, रिस उठेको हुन्छ, हात यस्तो काट्दाखेरि मेनी पिपल हेभ रिपोर्टेड कि उहाँलाई अलिक सानोमा कति जनाले सेक्सुअल अब्युज गरेको हुन्छ, तपाईलाई पनि त्यस्तो भएको थियो. So what we are doing is normalizing that your emotions are normal for a abnormal situation. So तपाईलाई पनि भएको थियो भन्दा you will feel like, hey, you know, it's okay to say रहेछ, because other people also have reported the same. Okay, so त्यो तपाईले बुझ्नु पर्यो. So यो उमेरको नानीहरुमा अब अगेन त्यो बदमास नानीहरु, एन्टी सोशल नानीहरु, अर्कालाई पिट्ने, झगडा गर्ने, चोर्ने, all those things come. The other thing here comes is यसरी उतौलो भएको भन्छ नि, lot of young girls when they act more flirty, ठुलो ठुलो केटाहरु देख्नु हुँदैन, उसको त बेउरा अलिकति अर्कै भइहाल्छ भन्छ कि भन्दैन तपाईहरुले? हैन आई हर्ड द्याट हैन उ त केटा देख्नु हुँदैन यस्तो भइहाल्छ भनेर सो द्याट क्यान बी अ साइन अफ मेबी शी वाज भायोलेटेड एन्ड okay then lot of suicidal again attempts ideation it might be just release of energy through they may not intend to kill themselves like the first example I gave you she wanted to she couldn't deal with her emotions so she was slitting her but it was not deep enough to cut but the second girl she wanted to die she didn't want to live okay so both may be there so be honest with them be I'm sure you all are doing that and I hope what I'm saying will help you a little bit more in the work that you are already doing right alright so a lot of times again this age group of girls and boys when they have एकदम pain in their chronic pains any complaint then again हामीले एउटा I don't like this term but I've still put it there hysteria भन्छ नि हामीले that अचानक हैन माता चढेको जस्तो या पेन्ट भएको जस्तो कुनै के भयो भने समथिङ abnormal has happened that it is so difficult to deal with it that they are now creating they are not jani creating that symptom but it is an unconscious psychological process जसले गर्दाखेरि चाहिँ उहाँहरु कि बेहोस हुन सक्छ कि माता भएको जस्तो लाग्न सक्छ कि हात खुट्टा चल्दैन ओके त्यस्तो हुन सक्छ so those are we actually call them as dissociative symptoms but this term has been used for a long time okay so I'm sure I don't have to tell you we should not criticize them we should not show that we are judging them ki bichara okay abo so having said all this हैन now तपाईहरुले चाहिँ त्यो याद गर्नु पर्यो कि जुन नानी तपाईको अगाडि आइराको छ अब 3 वर्षकोमा यति गर्दै गर्नुपर्ने 5 वर्षकोमा यति गर्दै गर्नुपर्ने अब अलिकति आइडिया भयो हैन तपाईहरुलाई सो यो नानी जुन तपाईको अगाडि आइराको छ त्यो चाहिँ यसकै एजको उमेरमा चाहिँ बिहेभ गर्दै छ कि छैन भनेर अलिकति एउटा तपाईलाई आइडिया हुनु पर्यो अझै पनि सारो पर्यो भने यु नो पिपल हु अब आमा बाउहरु आको हुन्छ नि सँगै हैन अब यसो तपाईले कुरा गर्न सक्नुहुन्छ नि कि नानी कति जना छ अब ठुलो नानी सानो यतिकै उमेरमा ठुलो दाजुले त्यही गर्दै गरेको चीज उले गर्दै छ भनेर सोध्न सक्नुहुन्छ कि आफ्नै क्लासमेटहरु जतिकै उहाँले अरूहरुसँग बातचित मार्नु बोल्नु खानु लाउनु हिँड्नु सक्छ कि सक्दैन so even if you don't know you can at least compare with the same age group in their school in their locality in their neighborhood it will give you an idea that whether the child is developmentally at the physical level or not बुझ्नु भयो so अलिकति चाहिँ याद गरिदिनुस् एउटा चाहिँ फिजिकल लेभल हुन्छ एउटा चाहिँ स्पीच र ल्याङ्ग्वेज अघि मैले भनिहालेँ एउटा चाहिँ सोशल हुन्छ बर्ताव गर्ने अर्को चाहिँ सोच्ने शक्तिहरु भएको कग्निटिभ अर्को चाहिँ के हुन्छ इमोसनल लेभल हैन अलिकति भन्यो भने पनि रुइहाल्छ के भन्नु हुँदैन ठुस्किहाल्छ भनेर सुन्नुहुन्छ तपाईहरु हैन सो अल दैट इज अगेन व्हाट सो इमोसनल लेभल चाहिँ ठीक छ कि छैन भनेर हो नि त ओके सो दैट चाइल्ड इज मोर रिएक्टिभ सो यो इम्प्लिकेसन केमा आउँछ बिकज इट कम्स इन द फोरेन्सिक इन्टरभ्युइङ ओके सो कति जना नानीहरु चाहिँ अब सायद बुद्धि शक्ति कम्ती होला नि intellectual capacity IQ level कम्ती छ भन्छ नि and if you see many children who are disabled intellectually or physically they will be the victims or the survivors of sexual abuse किनभने उनीहरुले भन्नु सक्दैन नि so I have heard so many reports of अलिकति अब ठुलै physically mature but अलिक बुद्धि कम्ती भएकोहरुलाई चाहिँ they are बिचारा the most people who are abused no so because perpetrators what will they do they are very smart no sometimes for children who are okay what they will do is they will groom them bhancha ni पहिला it will not start at once with rape no it will start with slight touching मिठाई दिने ऊपर जुम्न हैन so they may groom them or somebody if they have a chance then they may at once do it but who is the easiest prey भन्छ नि शिकार चाहिँ कुन चाहिँ सबसे सजिलो हो हैन जो चाहिँ लाचार हुन्छ जसले चाहिँ बातचित भन्न सक्दैन या भन्नु सक्दैन उहाँहरुमाथि त्यो हुन्छ and the other thing is usually family or known people are the perpetrators. I've seen in many cases who have come to the hospital and it creates more confusion. You know why? One young girl had come to me. She is not from Sikkim, she is from Kharsiong. She has some relatives here, so you know she was having some depressive again features, so she was brought to the hospital and not improving, you know. So then she was referred to me. So then मैले विस्तारमा हिस्ट्री लिँदा बुझ्दाखेरि then she told me that she was abused when she was younger. She was quite old already. अब old भन्दाखेरि बुझ्दै थियो उसको around 10-11 you know she got abused by her cousin brother. She went and told her mother. तर के रहेछ भन्दा आमाको दिदीको छोरा रहेछ. So the mother did not report to anybody. So now she has so much of confusion about her relationship with her mother that when I needed my mother did not speak up for me. So you see the ramifications जुन चाहिँ असर पर्छ. It is at different levels, no, depending on the case. Now her own relationship with her mother is, you know, it's very conflicted. अब आमाले उसको स्याहार गर्दैछ, बात दिँदैछ, बातचित मार्दैछ, सबै गर्दैछ, तर my mother didn't stand up for me for the biggest thing that happened to me. भनेर चाहिँ त्यो चाहिँ उसको आमासँग छ. So she doesn't know how to react with her mother, you know. So we are working on that right now. So these are very important, and that's why we have put in that intervention part also. Okay, intervention now again based on the case history of the person, we have to be careful. So again, this was just, I put this slide because I don't think the people at the back have attended my other lecture. I have given one presentation on how to ask questions. Okay, so we said that there is के भन्छ त्यो जुन चाहिँ funnel भन्छ नि, पेट्रोलहरु हाल्दाखेरि क्यानमा हामीले यस्तो फनलमा हाल्छ हैन, हो त्यसरी पहिला चाहिँ ब्रडली सोध्नु पर्यो, त्यहाँदेखि हो भन्दै गएपछि चाहिँ त्यहाँदेखि लास्टमा मात्रै यस र नो मा आउनु पर्यो. ओके, सो लिडिङ क्वेशन्स नसोध्नु भन्छ ए उ यो काकाले गरेको है भनेर तपाईले भन्न भनेर चाहिँ कोले गरेको भनेर चाहिँ त्यस्तो पाराले सोध्नु पर्यो हैन. अन्त काका नै हो है भन्दाखेरि चाहिँ लास्टमा कन्फर्म गर्नुको लागि मात्रै. अलराइट, so again here I will just reiterate, अलिकति तपाईले यस्तो नक्साहरु देखाउन सक्नुहुन्छ. I will show you, म तपाईलाई एउटा नक्सा देखाउँछु. यसले यसको हेल्प लिएर चाहिँ तपाई मलाई भन्नुस् कि काकाले कहाँनिर तपाईलाई आया गर्यो हैन. So there are boy also, girl also, right? Because and many a times we feel that only girls are abused. There are many boys also who are abused, but we don't give them an opportunity to come and tell us. So as more boys are also coming, and boys ko चाहिँ के हुँदो रहेछ भन्दाखेरि once they reach a little older, then there is a lot of anger and frustration, and especially if they feel like home. And you know, I think guys take more offense saying chhakka भने हैन. It feels that उनीहरुको manhood मा नै effect परेको जस्तो. So there was this young boy who had come to me. He was studying in a nearby college. He was I think they had gone out for some party or something, so he was little bit अलिकति drunk नै थियो. So he was above 18. So when he was drunk, he felt someone trying to violate him, हैन. So त्यो चाहिँ now he has taken it so much in him that now if he gets a little bit drunk, he's just going and fighting with everybody, beating up people. Now he doesn't have any friends. He came to me because he doesn't have friends भनेर खासमा. So I started inquiring, what happened with your friendship, you know. So any friend अलिकति मातेपछि now he is starting to beat them up. Okay, so men especially, they have what we call as reaction formation. अब त्यसलाई त कुट्नु सकेन, त्यति बेला त्यो भइरहेको थियो, तर आफू चाहिँ जो पाए त्यसलाई अलिकति if he gets a cue कि यसले अलिकति यस्तो गर्नु खोज्दैछ means अब सबैलाई कुट्दैछ उसले. Okay, So there may be reaction formation in boys. A little bit on children's memory. नानीहरुको memory हुन्छ मैले अघि तपाईहरुलाई भने. Alright? तर they don't have the language or the capacity to tell you कि के भएको थियो. So we can help them through different techniques. अघि मैले भने role playing, demonstration देखाउनु र हाम्रो एउटा psychological terms मा चाहिँ there is one questioning method called scaffolding. Scaffolding भनेको बुझ्नुहुन्छ हैन? त scaffold गर्छ नि त्यो थाङ्रा लाउँछ नि. पेन्टिङ गर्दाखेरि के गर्छ पेन्टरहरुले बाँसको हैन एउटा सपोर्ट जस्तो दिन्छ नि. So this technique is for first level देखि त्यहाँ जाँदाखेरि how we ask them certain questions. So this is a questioning technique. So these are ways to support कि like supporting could be अघि त्यो बर्थडे हैन बर्थडेमा त्यो को थियो त्यहाँ त्यो क्रिसमसको अगाडि कि क्रिसमसको बादमा so those are the questions that we can ask them. The other thing is, have you noticed children हरुलाई तपाईले राखेर बात मार्न सक्नुहुन्छ यता उता कुदिबस्छ नि attention span एकदमै कम्ती हुन्छ. So long periods of time where you are making them sit and making them asking questions, it is not going to work for you. Is he sleeping? Am I too boring? No. Okay. So the quality of information and the quantity of information is governed by a child's attention span. Attention चाहिँ केमा आउँछ cognition मा आउँछ नि हैन. So अहिले तपाईहरुले अब मैले बेसी बोल्न थाले भने एकछिनमा तपाईहरु पनि attention लुज हुन थाल्छ हैन. नानीहरुको झन् छिटो लुज हुन्छ. त्यसले गर्दा if you see for 3-year-olds maximum भनेको 15 minutes हामीले उनीहरुको attention hold गर्न सक्छ. Okay. So for little older children it goes to 4 to 5 years 20 to 25 minutes. Tara it could be now again we have to, if we are doing some sort of other activity with them हैन, we need to keep on refocusing them हैन. मैले यो सोध्दै थिए नि भन्दाखेरि त्यहाँदेखि उनीहरुले के भन्छ ए हो नि ध्यान अर्कैतिर हुन्छ हो नि हैन नि भनेर पनि भन्नु सक्छ. ओके. So त्यसले गर्दाखेरि because of attention only and when we redirect them गरी so when we interview them keep the interview session short depending on the age of the child. किनभने तपाईले जति बेसी राख्नुहुन्छ अहिले तपाईले के पनि पाउनु हुँदैन. तपाईको पनि टाइम वेस्ट हुन्छ नानीलाई पनि ट्याक्स हुन्छ. बुझ्नुभयो? So 8 to 10 years can speak up to 30, I would still say 30 minutes. Okay. Then 10 to 12 years they say up to an hour, but again we have to keep on redirecting them, bringing them into focus. Okay. This slide is based on what we have discussed in my next earlier presentation. So we are all interested कि अब यो कालो कालो चाहिँ नो हो रातो रातो चाहिँ यस हो. ओके. सो 3 years ले हु र व्हाट मात्रै भन्नु सक्छ कोले गरेको थियो र के गरेको थियो त्यो पनि थ्रु सम इन्डिकेसन. 4 वर्षदेखि 6 वर्षको लागिले दे क्यान से कि हु व्हाट वेयर कहाँ भएको थियो कोले गरेको थियो हैन. 7 to 8 ले चाहिँ कहिले पनि भन्न सक्छ बट नट द एक्ज्याक्ट डेट बट बर्थडेको बेलामा त्यो काका त्यो कि समर हलिडेको बेलामा हैन विन्टर हलिडेमा हामी जब नेपाल घुम्नु गएको थियो नि सबैजना सँगै सुतिरहेको थियो त्यति बेला राति दाजुले मेरो अन्डरवेयर तल गर्यो. एन्ड दिस इज अ रियल थिङ दैट समबडी टोल्ड मी. ओके. 9 to 8 years through with structured support they can give you a structured report. Okay, to quite an extent. And 11 देखि 12 वर्षदेखिले चाहिँ निकै राम्रो गरेर contextual details देखि they may not tell you still the exact date but they will give you a good time frame. It was in the month of October or something like that. Okay. So when you interview minimum 3.5 years जतिको नानीहरुलाई मात्रै इन्टरभ्यु गर्नुस्. उहाँभन्दा सानोलाई त गरेर पनि तपाईहरुको केही फाइदै हुँदैन. ओके. Important thing is अहिले because of our socialization children are beginning to talk later than before. Phone मा मस्त हुन्छ नानीहरु आमाहरु काम गरिरहेको हुन्छ. Many cases have come like that to me. Okay, so it's easy no नानीलाई बदमास गर्नु भन्दा फोन दिँदा रहेछ अन्त के हुन्छ नानीले बोल्नै सिक्दैन पछि उनीहरुले जानेको चीज पनि भन्दैन. ओके. Other thing is, I already gave you a little hint कि जब IQ problem हुन्छ त्यति बेला we might have issues. Okay, so you need maybe, and especially some people may not be able, they may be mute, हैन? त्यति बेला I think now social welfare has provided translation services and all. Okay, so we need to keep note of both the social and cognitive level of the child, and we can also use play and other creative methods, हैन, to explore whether abuse has happened. Okay, our effects ma जाऊँ है अलिकति, so that this is something which is again I hope will be helpful to you all in one way. When we talk about effects, we look at it from a trauma perspective. Okay, I think some of you have also attended my trauma lecture. So trauma is what? जब केही एउटा आइपर्छ हैन, and it can happen because I scold you in front of everybody also, no? So trauma has different levels, but child sexual abuse is the worst level again. So how we respond, trauma चाहिँ के हो? जब हामीलाई केही नराम्रो हुन्छ हामीले त्यसलाई कसरी सामना गर्ने, त्यसलाई कसरी झेल्ने र हामी कसरी अघि बढ्ने. So trauma को short term effect पनि हुन सक्छ, long term effect पनि हुन सक्छ. अब short term effect can be एकछिन अनि मेरो मन दुख्यो, या for young girls like band director sir was saying, नानी pregnant हुन सक्छ हैन. Long term effect could be confusion in your sexuality, emotional dysregulation, हैन. So trauma, and any kind of trauma, forget sexual abuse, can affect your मानसिक स्थिति हैन, साइकोलोजिकल. जसरी तपाईको कोपिङ रिसोर्स हुन्छ, जसरी तपाईले केही नराम्रो हुँदाखेरि, नकारात्मक चीज हुँदाखेरि त्यसलाई कसरी तपाईले झेल्नु सक्नुहुन्छ, सामना गर्न सक्नुहुन्छ. तपाईको रिलेशनशिप हैन, विथ द अपोजिट सेक्स, विथ द एल्डर्स, विथ एनीवन, नयाँ सिक्ने एउटा शक्ति र तपाईले जुन उमेर अनुसार तपाईले सिक्नुपर्ने चीजहरुमा पनि बाधा आउन सक्छ, रोकावट आउन सक्छ. ओके, it also affects हाम्रो physiological response. त्यसको बारेमा you will be surprised, I will tell you a little bit in detail later. And general overall आफ्नो बारेमा के सोच्नुहुन्छ, आफ्नो दुनियाको बारेमा के सोच्नुहुन्छ. Is the world a bad place where everybody is out to get you? हैन. अब imagine when you are on high alert all the time. Okay, it will affect sometimes your spiritual relationship. भगवानलाई माथि कति हैन, that दोष पनि दिन सक्छ. So you may become a के भन्छ नास्तिक person. So now let's look at a little bit in detail. Okay, first thing, sir, as I told you many times, perpetrators are groomers. क्या उनीहरूले चाहिँ कुरा म्यानिपुलेट गर्छ नि. Sometimes they'll say उपर जाउँ, अघि मैले एक्जाम्पल दिएँ हैन, उपर जाउँ मिठाई किनिदिन्छु, प्यान्ट खोल्यो भने हैन, मलाई यो गर्नु दियो भने म तिमीलाई मिठाई किनिदिन्छु, I give you a chocolate. So what it does is it creates confusion for the child, not only for that sexual aspect but also with care and love, that only if I do this I will get this. So it becomes a very transactional kind of a level that the child may go into. Okay, so they may not be able to normally give and receive love. Second, कतिजना हुन्छ नि that because they may groom, they may give more attention. So the child for that attention, नानीहरुलाई त attention seeking नै हुन्छ नि नानीहरु हैन. So त्यसले गर्दाखेरि बादमा they may have confusion with आफ्नो sexual identity also, and also about sexual norms. कि what is right, what I can do and what I should do and what I should not do. हैन भनेर त्यसमा पनि confusion आउन सक्छ. Because a lot of times the perpetrators create some sort of excitement, क्या? And especially this has been seen in the more Western kind of examples, that they create some sort of excitement. Oh, this is a special secret. You know, only you and I, and you are a very special person. That's why only you and I can share, and I will not share this secret or this activity with anyone else, but only with you. Oh, this to parle pani groom garnu सक्छ. So that also again creates differences. Okay, confusion in the child. Then कतिजनाले नानीहरुलाई डराउँछ हैन कि कसलाई भन्दियो भने यस्तो गर्दिन्छु, आमा मार्दिन्छु, बाउ मार्दिन्छु. That creates a lot of fear and if anybody alikiti yasto threatening stance liyo bhane ni that child may become fearful and agree to whatever the other person says even in later life. बुझ्नु भयो? त्यहाँदेखि confusion create गर्छ उनीहरूले to make themselves feel good. So the perpetrators create confusion for the child and that it's okay to do this, it's okay to do that भनेर. So again there's confusion about both sex, love, caregiving, care getting. Okay, त्यो हुन सक्छ. त्यहाँदेखि अब त्यो suppose there is penetration or fondling or anything and the child does not enjoy it. हैन? If they enjoy also, now they may be guilt related to that. But if they don't enjoy, what will happen is that any kind of touching or any kind of sexual activity is associated with fear, anxiety, overwhelming feeling of, la ke huncha ko bhanera dhar euta baseko huncha. So they will not be able to form normal sexual relationships later. Okay? And they may not be able to have sexual intimacy or even into healthy normal human intimacy without sex puni, they have problems. Like this Australian example I gave you, she is also confused about her sexuality and she wants help in trying to understand who she is actually attracted to. Okay? So pressure because on the child secrecy को लागि हो भने अब सिक्रेट राख्नु भने त के न के एउटा गडबडी छ नि हो कि हैन भन्नुस् त कोलाई नभन भनेपछि त दैट मीन्स ए झन्न के छ यसमा हैन क्याच 22. सो दैट अलिक बुझ्दै जाँदाखेरि त्यहाँदेखि झन् नानीहरुलाई के हुन्छ गिल्ट शेम हुन थाल्छ. ओके, offenders often blames the victim. Okay, they create confusion से तैँले नै यस्तो गरेको थिए नि तिमीले नै मलाई त्यस्तो गरेको थियौ. And child is at that level or that and a lot of times I want us also to be careful, society also to be careful कि ओ यस्तै how many times we've said कि यस्तै लुगा लगाएर त यस्तो भएको भन्छ कि भन्दैन, right? Lot of times absurd things like I think one MLA from Haryana said Chinese food खान्छ केटाहरुको के भन्छ सेक्स हर्मोन्स बढ्छ अरे अन्त केटाहरुले रेप गर्न जान्छ अरे भनेर भनेको छ. हो त्यस्तै केटीहरुले यस्तो लुगा लगाएर राति घुम्नु गएर हैन आमा बाउले उलाई लुज छोड्दिएर मोनिटर नगरेर भनेर चाहिँ we also engage in some level. Okay, so let us from today at least the handful of us 15-20 of us be careful when we say these things. Okay, and there's lot of shame about these attitudes. त्यसले गर्दाखेरि उनीहरुको नर्मल एउटा डेभलपमेन्टमा नै बाधा आइपुग्छ. अन्त like so was saying in the morning स्टिग्मा आउँछ. सोशल लाइफमा प्रब्लम आउन थाल्छ कि अब उलाई कसले बिहा गर्ने उलाई त शी इज अ सेक्सुअल के भन्छ अब्युज भिक्टिम. सो दे themselves will have that thing कि now I'll never be able to marry, I'll never be able to have a family. त्यो सोच्दा नै मनमा कति तनाव आउँछ हैन. त्यो भएपछि उनीहरुले कोशिश पनि गर्दैन. Maybe there are people who have accepted. I know of recently also what happened is there was one gentleman who was admitted in our hospital for alcohol abuse. हैन उहाँ चाहिँ अल्कोहल विथड्रल भएर आउनु भएको थियो. अनि कुरा गर्दै जाँदाखेरि he wanted me to talk to his wife because she had been abused. And that means he had married her knowing her history, okay, that she had been abused. But he was concerned that उनीहरुको बादको रिलेशनशिपमा केही प्रब्लम नहोस् भनेर. So there are people who will accept, they will marry, but because of how we may think, we may not initiate. If I am abused, I may think that nobody will marry me, so my normal relationships also get spoiled. So अब ट्रमा को अघि मैले अघि नै धेरै एक्जाम्पल दिइसके. सो दिस इज जस्ट अ कोलेसन अफ व्हाट ऑल विल ह्यापन. सो यसो हेर्दाखेरि व्यावहारिक रूपमा नानीहरुमा चाहिँ रिग्रेसन हुन्छ हैन. टोयलेट ट्रेन भइसकेकोहरु पनि टोयलेट ट्रेनिङ हुँदैन, रिस देखाउँछ, झिझट गर्छ हैन, झगडा गर्छ आमाहरुसँग हैन, बाबुहरुसित आउटबर्स्ट हुन्छ, स्लीपमा प्रब्लम हुन्छ कि नाइटमेयर भएर राति तर्सिँदै उठ्नु पनि सक्नुहुन्छ उहाँहरु हैन. कतिजना भनेको कुरा मान्दैन, अटेरी गर्छ, कतिजना त्यहाँदेखि now when we go to a little bit older age there is early initiation of smoking. A lot of times smoking and drinking is because they cannot control their emotions. बुझ्नुभयो? जब तपाईहरु पनि सुन्नु भएको होला नि आज कति काम गरे अब Saturday night हो रिल्याक्स गर्नुपर्छ भनेर हैन. So how do people relax? By taking a glass of beer. I think there are fewer men here, so I think women will drink wine or some. What do you do? I don't know. Right? So, lot of times when I speak to people who abuse alcohol and drugs also, that is one reason they give. क्या tension कम्ती हुन्छ अरे क्या उनीहरुको खाएपछि बिर्सिन्छ अरे भन्छ नि. हो यसरी नै maybe you are self-medicating yourself to control your own emotions when it becomes so overwhelming and you are not able to handle, when there's confusion, guilt, anger, shame, it's such a mix of emotions that are there. Okay, some become promiscuous, they may have more sexual partners. Alcohol and drug abuse त हुन्छै हुन्छ. त्यहाँदेखि रिप्रोडक्सनमा अनवान्टेड प्रेग्नेन्सी, टिनेज प्रेग्नेन्सी हैन, सानो सानो नानीहरुमा पनि now because menstrual age is becoming lower, more young children are also getting pregnant. अन्त त्यहाँदेखि one important thing is future intimate partner violence भन्छ कि त्यो चाहिँ आफ्नो नजदिक रिलेसनशिपमा चाहिँ कुटपिट मारपिट हुने. ओके, सो मैरिटल रिलेसनशिपमा भाइलेन्स हुन्छ. Social outcomes, especially in the US, many times incarceration भनेको चाहिँ crimes commit गरेर जेल जाने. Homelessness, त्यहाँ चाहिँ more homelessness because you have to have quite a lot of money to have a home, हैन. अब यहाँ पनि I don't know, there are a couple of homeless people walking around. Now important thing is अब you all have heard that there is depression, there is anxiety, हैन. You have heard that post-traumatic stress disorder भनेर सुन्नु भएको छ. ओके, सो त्यो चाहिँ एउटा भयंकर एक्टिभिटीज there. त्यसको आधारमा there is different physiological reaction and imagery आउँछ, anxiety जस्तो आउँछ, panic attack जस्तो आउँछ, डर एकदमै हुन्छ. ओके, sexually transmitted disease त हुन्छै हुन्छ, HIV पनि हुन सक्छ, health related quality of life हैन. Now I'll tell you, did you know that having some sort of abuse, and it's not only sexual abuse, it's a trauma history. Okay, so there was one study done in the US, in Southern California. Okay, that study was called the Adverse Child Experiences Study, ACE study. तपाईले बादमा गएर पढ्नु पनि सक्नुहुन्छ. So around 17,000 people लाई चाहिँ one group called Kaiser Permanente, they interviewed about 17,000 first study मा चाहिँ, and उनीहरुलाई चाहिँ इन्टरभ्यु गर्दाखेरि दे इन्टरभ्युड कि चाइल्डहुडमा के प्रब्लम थियो तपाईहरुलाई हैन. सो नट ओन्ली अब्युज बट गाली, फिजिकल अब्युज, निग्लेक्ट, त्यस्तो सबै. सो एनीथिङ इज कॉल्ड अ ट्रमा. सो as the number of trauma events increased, there were more health related problems. Okay, and not only in mental health problems but also on physical health problems. Cancer, cardiovascular disease, respiratory disease. अब respiratory मा आए नि सबै हैन, pulmonary disorders, TB, okay, heart मा सबै आयो, liver disease, okay, and also diabetes. So when we look at it now, we need to look at it from a holistic angle. किनभने जब अब्युज हुँदै गरेको हुन्छ त्यति बेला हामीले त्यो whether it is sexual abuse or physical abuse, हामीले त्यो सिचुएसनसँग, परिस्थितिसँग हामीले संघर्ष गर्नु पर्यो. त्यति बेला डर लाग्दाखेरि कसको मुटु डुकडुक गर्दैन? सबैको गर्छ. मुटु डुकडुक किन गरेको भन्नुस् त? डर लागेर है. So there is a biological or a physiological reason for that. डर लागेपछि त्यो डरसँग अब सपोज यहाँ है, अब ग्याङटोकमा भालु पुरा हुन्छ हैन, पहिला अहिले आउँछ हैन. अब भालु आएपछि के गर्नु पर्यो? हामी हेरिबस्ने भालुलाई हैन भाग्नु पर्यो नि हैन अब त्यो हामीलाई डर लागेन भने हामी भाग्नु सक्दैन हो कि हैन सो आवर ब्रेन हैज टु से कि ओके बालु हो बालु डेन्जर हो बालुले खान्छ छिटो भाग अब मनले त भन्दैछ तर हाम्रो जिउले रियाक्ट गरेन भने हामी कसरी भाग्नु हैन सो के गर्छ हाम्रो त्यो मुटु डुकडुक गरेको चाहिँ छिटो प्रेसर बिल्ड गरेको नि हाम्रो हार्टमा ताकि त्यो ब्लड प्रेसरले गर्दाखेरि हाम्रो हात खुट्टामा चाहिँ एनर्जी जाओस् अनि हामी भाग्न सकोस् ओके सो घरिघरि मनको भालु आयो भने तपाईको मुटु डुकडुक गर्यो भने यु आर चेन्जिङ योर बायोलोजी भालु गएपछि त हामी सबै फेरि नर्मलमा आउँछ नि तर अघि नानी मैले भने नि 3 वर्षको मैले तपाईलाई के कारण यही एक्जाम्पल दिनको लागि मैले अब्जेक्ट पर्मानेन्सको कुरा गरेँ नि कि त्यो भालु या मान्छे त्यही छ जस्तो लाग्यो भने कि फर्केर आउँछ जस्तो लाग्यो भने त्यसको याद आउँदा नै हामीलाई डुकडुक हुन थाल्छ कि हुँदैन त्यसले गर्दाखेरि चाहिँ हाम्रो वी आर चेन्जिङ अ बायोलोजी त्यसले गर्दाखेरि वन्स वी चेन्ज आवर ओन फिजिकल त्यसलाई चाहिँ हामीले अटोनोमिक नर्भस सिस्टम अराउजल भन्छ त्यसलाई नै हामीले चेन्ज गरेपछि चाहिँ के हुन्छ भन्दाखेरि हाम्रो इम्युन रिस्पोन्स नै चेन्ज हुन्छ एचआईभी क्यान्सरहरू सबै के हो एउटा इम्युनोलोजिकल रिस्पोन्स हो नि हाम्रो बडीमाथि के एउटा फरेन चिजले एट्याक गर्दाखेरि हाम्रो बडीको त्योसँग फाइट गर्ने शक्ति कम्ती हुँदाखेरि हामीलाई बिमार भयो हैन त्यो फाइट गर्ने रिस्पोन्सलाई चाहिँ कम्ती गराउँछ बुझ्नुभयो त्यसले गर्दाखेरि नै नाउ डु यु अन्डरस्ट्यान्ड द बायोलोजी बिहाइन्ड वाइ हैन अन्त डिड यु एभर थिङ्क डायबिटिज इज अल्सो रिलेटेड टु इट हार्ट प्रब्लम आई वाज अल्सो सरप्राइज्ड हैन सो देन many studies were done over the world okay not only in the US so that is why it is very important as sir mentioned in the morning that we need to talk about it create noise about it so that we prevent these kind of abuses from happening so that we can actually have an impact not only on the current mental and physical health of the person but also overall life but not only today but in the future also so maybe later we can have a study like that because I also find it very surprising कि हाम्रो सिक्किम त कस्तो रहेछ भनेर when I sit in the hospital and I interview children that पहिला and so casually some people tell me one girl she's a teacher she came with some other issues then and this case was about she had a very usko ama bau khaseko dekincha she was in a grieving situation tele gardakhari so it was my oversight also मैले पनि सोधिन हैन उसँग as I was helping her we were talking and all she improved a lot then again she came last month and कुरामै then she told me सानुमा पनि त्यो एउटा दादाले मलाई त्यस्तो गरेको थियो नि तर त्यो त मैले यादै गरेको छुइनँ त्यसले गर्दा मैले तपाईलाई पहिला भनेको आज मात्रै भनेको अरे so it is more common than not for people who are having problems okay so having said that these are for हैन अब यो हेर्नुस् त normal development भयो हैन एज यसरी बढ्दै गएपछि चाइल्ड डेभलपमेन्ट यसो बढ्दै जानुपर्ने normal development अब road traffic accident happened let's say at 12 years children will recover pretty fast okay but then mother's role is very important here so loss of mother at age 5 is quite bad and child sexual abuse is not as bad it shows this is one of the studies that was done okay and if this is after the child has been given help then they can recover okay so it's not to say that अब यो death sentence हो हामीले के गर्नु सक्दैन that is why I put this slide up so that even after going through problems and issues हैन we can help them to lead as normal a life as possible okay so therefore we play a big role and यता हाम्रो law enforcersहरूले चाहिँ you can create the opportunities so that they can get further help okay so this I think I'll do this thing so let's talk about more in terms of protection recovery and reintegration अब the topic given to me was rehabilitation but I thought this is rehabilitation sounds एकदम physically challenged मान्छेहरुलाई हामीले फिजियोथेरापी गरेर रिहेबिलिटेट गर्नु परेको so I just changed it around to how we can further protect the child, help the child recover and reintegrate back into normal life. Okay, so यसमा चाहिँ again the main focus here is assessment हुनुपर्छ नानीको, हैन? तपाईले पनि गरिरहनु भएको छ, अझ तपाईले आजदेखि अलिकति बेसी ज्ञान पाएर तपाईहरुको एसेसमेन्टमा पनि अलिकति के सोध्नु हुने भनेर एटलिस्ट एक दुई कुराहरु सिक्नु भयो होला भनेर मेरो आशा छ, है? So first thing, as social welfare child protection officers हरुले जो चाहिँ फर्स्ट रेस्पोन्डर्सहरु हुन्छ त्यो चाहिँ उहाँले के गर्नुहुन्छ भन्दाखेरि they will verify if the suppose there is allegation, हैन, whether the child is in immediate danger or not, त्यो चाहिँ गर्नु पर्यो नि, हैन, so that we prevent further abuse. Okay, so whether the child needs to be taken to a shelter home or a child care institute, हैन, and whether there are relatives who will take care of them, and फेरि त्यो relatives जो चाहिँ लग्यो whether they are a nurturing family environment. अब त्योबाट निकालेर फेरि यता चाहिँ सेक्सुअल अब्युज चाहिँ भएन तर काम भक्कु लगायो, हैन, काम गर्ने जस्तै राख्यो भने त फेरि भएन नि त, अर्को अब्युज भइहाल्यो, हैन. So we need to look at overall safety and nurturing kind of an environment so that the child is able to be a child. So whether मैले भनिहालेँ कि फस्टर होममा राख्नु, त्यहाँदेखि अब सपोज हैन सेल्टर होममा कतिजना तपाईहरु देखिराको मैले, अब त्यहाँबाट पनि आमा बाउ के भन्छ कति दिन राख्नु भने एउटा तपाईको फिट फेसिलिटी हुन्छ, हैन, छोटो राख्ने, त्यहाँ फिट फेसिलिटीबाट यता वेलफेयर बोर्डमा आएर suppose the family is not willing or not able, not nurturing enough, then they send the child to the CCIs, हैन. So otherwise fit facility मा राख्यो, त्यहाँदेखि if everything is fine, त्यहाँदेखि फेरि घरमा ठिकै छ भने then you send the child back. Other thing is parenting capability. So I had visited for one case, one juvenile observation home in Namchi, and it was not my case but somebody else's case before me. So I was talking to the house father there कि हैन नानीहरु कस्तो छ के त्यसै मेरो केस पर्खिँदाखेरि. So he was telling me के गर्नु म्याडम, बाबु नै मातेर हिमी बस्छ अन्त नानी यस्तो हुन्छ नि, because it was a child in conflict with law because he had perpetrated on another young child. Okay, so both of the children were juveniles. So lot of times parenting capability, sometimes it is like absent parenting, आमा अब बाबु छ तर मातेर हिँडेपछि पनि एब्सेन्ट जस्तो भइहाल्यो. अर्को के हुन सक्छ, नेग्लेक्ट हुन सक्छ, लाइक वन, अब दिस इज नट अ चाइल्ड अब्युज केस बट द सोशल डेभलपमेन्ट डिले भएकोमा चाहिँ बाउ चाहिँ आर्मीमा रहेछ, आमा चाहिँ घरको काम गर्नु कि नानी 2 वर्ष आदि कति त कुद्दै होला, हैन. सो त्यसले गर्दा फोन दियो, हैन. सो इन वन वे इट इज नेग्लेक्ट. सो नर्मल ल्याङ्ग्वेज डेभलपमेन्ट, कग्निटिभ डेभलपमेन्ट नानीको भएको छैन. देन whether the child needs therapy or not. Okay, so we need to assess that. So this is done by social welfare, child welfare, हैन, हाम्रो forensics and हाम्रो clinical. So यसमा चाहिँ सबै के हुन्छ, सबैजना want to gather information first of all, भएको हो कि हैन, कस्तो पाराले भएको, हैन. Social welfare will have to help them to, take them to the courts, help the family to understand the court proceedings also, हैन. कति बेला आमा बाउलाई नै, how many of you have to deal with the parents because they might be in a situation के गरौँ, they don't know what to do, हैन. So यति बेला we need to be engaged, we need to be empathetic, and we need to focus on the strength of both the parents and the child. Okay, so training is usually in social work and we document it in a written format. Forensic is more objective, fact finding, legal proceedings ko lagi. Okay, so I think I don't have to tell in detail. So a lot of times with children now it is being videotaped so that the interview is carried out and you don't have to face the perpetrator or it is in a special court. So all those sensitive issues are dealt with very sensitively. So I'm very appreciative of that. And the clinical again we gather information, we see what are the short-term mental health impacts, and many a times naniyaru, what I have seen is also they are quite resilient, स्पेशली इफ इट इज अ one time, 2 time, if it is not like बारम्बार भएको हुन्छ नि, त्यति बेला नानीहरू आयो भने चाहिँ they are quite resilient, and because they don't have that language capacity, as I told you, they are not able to tell also, and they behave very normally. So what we do is we do only a normal assessment, but then we do a lot of work with the parents so that the parents normalize the childhood of the child. Okay, अनि अर्को कुरा चाहिँ then we also teach the parents हैन कि to look out for all these signs and symptoms. जब एङ्गर आउटबर्स्ट बेसी भयो, छोड्नु डाँट्यो, के गर्यो यस्तो भन्छ, सो अहिले पनि भएन नि यस्तो बादमा हुनसक्छ, त्यति बेला चाहिँ तपाईँहरूले ल्याइदिनुहोस् भनेर, सो द्याट वी आर एबल टु हेल्प देम एट द्याट टाइम. सो दिस इज वाट आई विल अपिल टु यु अल अल्सो कि तपाईँहरूले पनि यो चाहिँ डोन्ट थिङ्क द्याट अहिले देखेन भने हुँदैन भनेर, बादमा हुनसक्छ नि, बुझ्नुभयो. सो वी निड टु बी एबल टु लुक एट द्याट. ओके, एन्ड हाम्रो जुन चाहिँ छ त्यो चाहिँ इट इज युजुअली कन्फिडेन्शियल, अनलेस द कोर्ट आस्क्स अस we will not reveal to anybody. Okay, so when you are interviewing, again active participation चाहियो both parents सित र नानी सित, okay, in both the recovery and the reintegration plan कि के गर्ने, कहाँ बस्ने, जसरी सरले भन्दै थियो, like, and sometimes we may have to relocate the family because the perpetrator might be there and they feel uncomfortable, or they feel that nobody will know, nobody will want to marry us. That can also be part of the reintegration, that we actually physically relocate them to some other place. Number 3 is important, okay, because we are talking about, in terms of rehabilitation, we are talking more in terms of psychological reintegration of the person there and later. So you would say हामीले psychoeducation भन्छ, this is just a fancy term, तर it is to help the child and the parents understand that यो चाहिँ भएको हो, and this, to tell about the situation and what may be expected in future. हामीले के गर्नु सक्छ, सोशल वेलफेयरले के गर्छ, कोर्टले के गर्छ, उनीहरूलाई राम्रो गरेर बुझाइदिने, ताकि दे once you know, हैन, अब once you, even when you are going somewhere, if you know कि त्यो सिचुएसन अलिकति फेमिलियर छ भने तपाईहरुलाई एंजाइटी त्यति हुँदैन नि. नयाँ जग्गा जाँदाखेरि केही थाहा छैन, अन्धधुन्धमा त्यहाँ जाँदा भाषा पनि नबुझ्दाखेरि हामी सबैलाई अलिकति हिचकिचाइ हुन्छ नि, हैन. सो दैट इज द कन्सेप्ट. ओके, देन वी टक अबाउट साइकोलोजिकल फर्स्ट एड. दिस इज अगेन हेल्पिङ द चाइल्ड एन्ड द पेरेन्ट्स टु एक्चुअली भेन्टिलेट भन्छ. ओके, अब भेन्टिलेसन भन्ने टर्म त तपाईहरुले बुझ्नुहुन्छ नि. भेन्टिलेसनको काम के हो? रूम भित्र भेन्टिलेसन हुन्छ नि, हैन, त्यसको काम के हो? भन्नुहोस् त. हावा छिर्नु हो नि त, हैन. पुरानो हावा, कार्बन डाइअक्साइड बेसी भएको हावा चाहिँ बाहिर जाओस्, बाहिरको सफा हावा चाहिँ भित्र आओस्. सो भेन्टिलेसन अफ इमोसन्स इज द्याट, कि हामीले आफ्नो मनको कुरा अर्कालाई भन्नु सक्यो भने अलिकति हल्का हुन्छ कि हुँदैन तपाईहरुलाई. सो द्याट इज द थिङ द्याट वी नीड टु हेल्प देम टु टक अबाउट इट. ओके, स्पेशली फर यंगर चिल्ड्रन, अगेन आई से नो, बट the parents, elder children need to talk about it so that they feel that their emotions, जुन चाहिँ भावनाहरु उनीहरुले फिल गर्दैछ, जब उनीहरुले भावनाहरुको बारेमा कुरा गर्न सक्छ, सिचुएसनको बारेमा कुरा गर्न सक्छ, देन त्यसले नै बोझ अलिक हल्का गराउँछ. ओके, त्यति बेला चाहिँ त्यहाँदेखि another thing you can do is to validate their feelings, कि it is okay, anybody would have felt scared यो सिचुएसनमा. कति डर लाग्यो होला तपाईलाई, हैन. त्यो त्यति बेला त तपाईलाई बेसी के ख्याल आएन, तर अहिले तपाईलाई यति गिल्ट हुँदैछ, हैन, यति मिठाईको लागि भनेर तपाईले भन्नु हुँदैछ भनेर. तर तपाई देन लिटल बिट यु क्यान एड टु इट दैट त्यति बेला यु राइट नाउ यु आर एबल टु अन्डरस्ट्यान्ड दैट इट इज राइट एन्ड रङ, दैट्स व्हाई यु आर फिलिङ गिल्टी अबाउट इट. बट त्यति बेला यु डिडन्ट नो व्हाट वाज राइट एन्ड व्हाट वाज रङ, नो. सो दैट्स व्हाई त्यति बेला यु डिडन्ट नो दैट त्यो मिठाईको लागि चाहिँ तपाईले यो गर्नुपर्छ भनेर, दैट यु विल बी लुजिङ सो मेनी थिङ्स, सो यु नीड टु अपीज दैट गिल्ट, रिअश्योर देम कि लु अब चाहिँ थिङ्स विल बी ओके, इट मे लुक लाइक इट्स होपलेस राइट नाउ, आई अन्डरस्ट्यान्ड इट, स्टे विथ द फिलिङ अफ द पर्सन, बट देन अगेन गिभ सम होप कि तपाईहरु जस्तो परिस्थितिमा भएको अरु नानीहरु पनि थियो उनीहरु अहिले राम्रो छ र तपाई पनि एक दिन तपाई हुनुहुन्छ नि right now you feel कि no you might not improve but I have seen many children like that so do you believe in me you know so be that sense of reassurance and hope for the child the parents and they will go back feeling better okay and emotional regulation अलिकति गराइदिनुस् त्यो भएपछि that is psychological first aid कि त्यो बिग्रेको चीजमा सम्हाल्नु हो नि त फर्स्ट एड भनेको के हो ब्यान्डेड लाउनु हो नि त हैन we are not curing them but we are at least preventing further harm guilt embarrassment for the child just by being genuine being empathetic there in the situation respecting them okay right then individual counseling cha abo now on one to one okay this is a more specialized kind of a field so if the child is feeling okay looks okay that's fine haina but does the child need more help okay sometimes they may need medication also because rati sutnuma problem bhako huncha kati janaलाई anxiety एकदमै कन्ट्रोल गर्न सकेको हुँदैन okay त्यतिबेला नानीहरुलाई पनि हामीले लो डोज एन्टी एंजाइटी दबाईहरु पनि दिन्छ then as the children grow up in CCIs I think you have attended my life skills intervention program both of you haina so we hope that it is not just one time it is अब लाइफ भनेको के हो भिन्दै भिन्दै परिस्थिति आइबस्छ हैन as age develops हामीले भिन्दै भिन्दै परिस्थितिको सामना गर्नुपर्छ डिसाइड गर्नुपर्छ सोच्नुपर्छ निर्णय लिनुपर्छ हैन त्यो शक्ति त्यो सामना गर्ने या त्यसलाई पार गर्ने जुन चाहिँ क्षमता हुन्छ त्यसलाई चाहिँ हामीले प्रदान गर्नु पर्यो नि नानीहरुमा मुखले भनेर हैन तर एक्टिभिटीहरु गराएर which I think some of you have attended and I think your उहाँहरुको आफ्नो आफ्नो CCI मा उहाँले गर्नु पनि हुँदैछ so next time we have a program like that I will definitely invite you all okay because we are going to have maybe next year त्यतिबेला म त I didn't तपाईहरुलाई चिनेको थिएन कति जना चाहिँ I visit the homes myself so I know them because of that so and once the child reaches 18 then के गर्ने so we need to prepare the child from before only okay yeah suppose the child doesn't want to stay in the CCI हैन and many CCIs also say कि अब 18 पुग्यो अब उनीलाई जान दिनुपर्छ हैन so are you all doing anything to prepare the child forget a child with child abuse I want some preparation to please take place for all children as they are 16 17 make them think okay what are the daily life skills you need simple things like even washing cooking cleaning taking care of yourself going to the shop buying some things budgeting so these are the normal life skills that we need to be able to help them with right because त्यहाँसम्म त्यतिबेलासम्म त बाहिर कोसँग इन्टर्याक्ट गर्नु पनि दिएन हामीले त्यहाँदेखि चाहिँ एकैचोटी बाहिर छोडिदियो भने many children do not know how to handle that freedom okay so the transition period ma chai is important and I think you must be having some guidelines I think where children are followed up and monitored हैन so after care भनेर पनि हुन्छ नि हैन so के गर्नु हुन्छ त्यसमा so some of the things that for specifically intervention for the family chai we need to this is not only mental health related but I would like to call it psychosocial kinabhane a lot of things are related to the socio-economic situation of the parents also हैन so कति जनाको अब basic needs नै हुँदैन कति जनाको आमा बाउ नै poor health हुन्छ like father absent mother not present many I think अहिले यो हाम्रो सिक्किममा हैन सोशो epidemiological transition हुँदैछ many single parent households so त्यसले गर्दाखेरि there are the different challenges which are coming out of school children आमा बाउलाई नानीहरुसँग कसरी बर्ताव गर्नु कसरी डिसिप्लिन गराउनु कसरी नकुटिकिन डिसिप्लिन गराउनु and it is not only with low socio-economic strata many educated people जब प्रब्लम एकदमै ठुलो भएर उनीहरुले सम्हाल्नु सक्दैन त्यतिबेला नानीहरुलाई खिचेर ल्याएको थियो I'll not and one very big person ले चाहिँ आफ्नो नानीको गाडी निमाटेर ल्याएको थियो मेरोमा अस्ति लास्ट विक ओके अब यस्तो बदमास गरेछ के गर्नु भयो अन्त सम्हाल्नु सकेन अनि यु नो सो पेरेन्टिङ आई थिंक सिक्किम नीड्स सम पेरेन्टिङ स्किल्स आई डोन्ट नो कतिजना हेभ पेरेन्ट चिल्ड्रेन एन्ड हाउ डिफिकल्ट इट इज यु नो स्पेशली यु नो चिल्ड्रेन हु आर भेरी स्मार्ट वर्बली हैन जवाब दिइहाल्छ त्यसले गर्दाखेरि पेरेन्ट्स डोन्ट नो हाउ टु रियाक्ट सो पेरेन्ट्स आर एट अ लस सो hopefully we'll be able to create some parenting modules also because this is one area of need personally what I have seen in my work over the years. So important is parent education, self-employment assistance, vocational skills training ko kura garihale हैन and this is not only with again the child also with the parent and educational assistance for the children, family counseling and therapy so that the way they are performing or interacting, engaging as a unit within the family also may need some intervention, communication, okay. So this is after the discharge from the foster home also, aftercare is required so that there is some sort of support for the child, you know, to sustain the gains that have been there within the CCI and also the healing process say it is lifelong, it is not only a one time or when they are in the CCI because sometimes problem comes when you start engaging in a normal relationship then you realize that oh you know I'm very suspicious or I'm you know very controlling, you know those kind of issues might come, okay. So a lot of youngsters come and say I had a very toxic relationship हैन उनीहरुको चाहिँ आजकल मुखमै टक्सिक भनेर पुरा आउँछ हुन्छ नि so I'm like okay explain what is toxic भनेर हुन्छ नि so they just pick up some words you know some catchy words and then they come, okay. So then monitoring both at the individual level and community मा पनि कस्तो पाराले monitor गर्नु किनभने many times like this PTSD I still have put it here because it has been shown worldwide that 1/3 of people who undergo rape they have PTSD, okay. So this comes to the end of my presentation. Hope it has been helpful because it is a very very huge topic and I have tried to make it as small as possible and at a level that you know is helpful to you and with very less technical terms. So maybe we can have a discussion about your work and if there's anything. And also anything sir?
Like Madam said, you took a long time to study the child psychology. So for us, I think one short session. I don't know whether I'm sure it will be of some help though. And I must say as a magistrate, we do examine, sometimes as a JJB magistrate, we examine the victims and we also record the 164 statements of the victims. So I think we are very, I must say, incompetent actually to understand child behavior and psychology.
Having said that sir, I feel the most important thing is for us to just be sensitive that you know they have gone through a lot and to just practice the basic humane which I'm sure you all are already doing, you know, being responsive, being polite, being respectful, you know. I think that goes a long way that okay even after I went through this such a big person is speaking so nicely to me bhandakeri nai that only indirectly will give them a lot of you know hope and reassurance. So the topic here is not to make you a psychologist but to make you sensitive enough to understand that it's not only the short term effect but there are long term effects also, you know, and that we need to, as you will be in a position to enforce, implement the JJ Act as well as you know the POCSO Act. As I was talking to Jamia madam also in the morning, right? अब तपाईहरु त इम्प्लिमेन्टर्स हुनुहुन्छ तर तपाईहरुकोमा पनि ज्ञान छ भने तपाईले मार्गदर्शन गर्नु सक्नुहुन्छ नि कि you can direct कि उहाँलाई send her for therapy, send her for assessment, the multidisciplinary team has to be there, family also needs intervention भनेर तपाईहरुले if you are able to do that much, right, that also is I think some change, a very big change that can become a norm as opposed to other places that are happening. So I think in that way it's not to make any of you a psychologist or a mental health professional, but to be aware and to be sensitive to their needs. I think that is the main thing.
Hello, ma'am. As per section 15 of the JJ Act, we, the JJ board, is supposed to make assessment, preliminary assessment of a child if the child at the date of commission of offence is over 16 years. So in making such assessment, we usually take the help of clinical psychologists. But then even with the help of the psychologists, how are we supposed to make such assessment about a child at the time, 2 months ago or at the time of the offence, commission of offence? And what is the yardstick according to you?
So ma'am, again, this is a very grey forensic area. Because now we are, because our mental health, it's our assess karsa, it is through the behavior, through the emotions and through the language of what the person speaks, the content. We are compromised also because we are not there during the commission of the crime, but we have to also rely on the narrative. Perpetrator, let's say the child in conflict with law, is telling us. So many a times what happens is, I have also seen and observed, is that they come very coached. So I don't want, this is being recorded, but maybe privately I'll tell you another personal incident I had with one of the law enforcement agencies. So we face difficulties with regard to that. So children are being coached, but children can't lie after a certain time. And we are coached and we are trained to pick up cues कि कसले चाहिँ अलिकति अब ढाँटेर म्यानिपुलेट गर्नु खोज्दैछ त तपाईहरुले पनि चाल पाउनुहुन्छ होला, मैले पनि चाल पाउँछु, and then we usually are able to find. But then for that, ma'am, what happens is we then interview the child in conflict with law or the survivor in this thing on a number of occasions, because it is not possible sometimes to give you all the information on the basis of one interview for an hour. And when the child has come coached, and sometimes there is no family, only the police brings them. So to understand the behavior of the child, so we need to ascertain some social situations, some academic. So whether they are able to stand trial in court becomes our main agenda at that time. So did he understand that it was a right thing or a wrong thing in the end, whether he was doing it and whether he was mentally sound or not. So mental soundness can be affected only by a few things, ma'am. So in psychotic cases, so psychosis cannot change from the commission of the crime to today if the person has not taken any intervention like dawai deko chaina. And psychosis ko lagi chai you do need medical, you need to take psychopharmacology. Dawai khanai paryo त्यसमा. So that becomes the बुझ्नु हुँदैछ हैन तपाईले कि दवाई दियो भने मात्रै बदलिन्छ. So what it means is that if today he is fine and he is able to speak, means then also he was speaking, thinking, doing every activity that he was supposed to do. So things cannot change so rapidly. You can get depressed. So today a child comes, he is depressed because obviously ulai ta ab jail jane sambhavna cha, हैन. So it is a normal reaction, but even a depressed person has the cognitive capacity to understand what is wrong and what is right. So if the mental status examination that we send you or the assessment we tell you says that there is no mental illness but there may be depressive features, he can still stand in the court of law.
No, but then the preliminary assessment is regarding his capacity, mental capacity and knowledge that the offense that he committed, I mean, he had knowledge that the act that he did was an offense or not. So regarding this, what are the questions that are put?
So usually what we ask, so usually mental status examination, we have one section called judgment. So whether that person is able to make a good decision or not. So we don't ask them, did you know what is that whether you were raping that person was right or wrong. You know? So we may give them other scenarios like, if there is a fire in the next building, what will you do? Or what should be done?
So you don't put any questions to the
child? We do.
Regarding,
we do. Of course we do. It comes only later. So we first talk about neutral topics and we judge them on the basis of that. Because here now what happens is that we don't at once, because the child comes intimidated. So we first do the mental status examination where the judgment part, because in the end mental capacity is judgment. You're judging whether you know your situation, your situation right, को परिणाम के हो भनेर त्यो बुझ्न सक्छ कि सक्दैन हो नि तपाईको मेन कुरा त हो कि हैन भन्नुस् त. So whether the person is able to make a decision looking at all the surrounding situation, taking all the social cues, environmental cues, is this person behaving in a way that is expected of the norm or not?
I have received a report. The report stated that the child at the time of examination was acting like a 14-year-old. So what, according to you, does that statement mean?
So madam, I will question the report. Okay, because हामीले चाहिँ त्यो acting like a 14-year-old भनेर a licensed, trained clinical psychologist will probably not write a statement like that. Okay, so maybe त्यो छ भने फेरि reassessment को लागि पठाउनुस्. Okay, किनभने हामीले के गर्न सक्छ, हामीले मेन्टल एसेसमेन्ट, मेन्टल आईक्यू लेभल एसेस गर्न सक्छ. त्यसमा के आउन सक्छ, सोशल कग्निटिभ हो, यो सबै डोमेन्स हुन्छ अघि मैले कुरा गरे, त्यो आउन सक्छ. अनि हामीले चाहिँ एउटा आईक्यू लेभल निकाल्छ. सो इट मे बी he may be functioning at a 14-year-old level भन्यो भने चाहिँ, so 14-year-old also is able to say right from wrong हो कि हैन भन्नुस् त. अनि त्यही कारण मैले तपाईलाई यति धेरै भने ताकि you get some idea कि 14-year-old ले पनि right र wrong त भन्न सक्छ नि. 10 र 11 देखि चाहिँ निकै नै आइसक्छ. 10 देखि मुनिको चाहिँ they might not be able to understand so well, right? But a 14-year-old is able to understand, no? So then what we usually do is that we write that is functioning at an intellectual level at 14 years of age. Now that should be a cue to you. That 14 years later, सक्छ नि. So लेख्नेमा अलिकति गल्ती भयो होला, तर अब तपाईले त्यही कारण this program should be helpful. That's why I wanted it to help you in that sense that you know which age group, because we cannot write that this child is a perpetrator or not, but we can give you a hint that at 14 the child is functioning at 14, but at 14 with your knowledge now you know that the child knows right from wrong.
Okay, thank you.
Does that help you? And maybe ma'am, I think it will be helpful here about all the judges in the JJ court, if they will send at least for an assessment so that you are also safeguarded in that sense, So at least you have at least some sort of intellectual functioning त्यो छ भने चाहिँ तपाईहरुलाई पनि helpful हुन्छ जस्तो लाग्यो. And this we discussed this in our previous meeting at legal services also.
If I may just add here, I feel this whole process of sending the child for mental assessment is very flawed, because we are assessing at a later stage.
I mean, given the loopholes, Aptara, if you look at it, unless you are psychotic, you will be the same, no? So it will give you some room to say that things will not change so much. If you are psychotic, means you are out of touch with reality. and you don't know what you are doing, so you perpetrate a crime. But if you are having a neurotic disorder like depression, anxiety, or any other disorder except schizophrenia and psychosis, then you know what is right from wrong. No? I may be depressed, I may be thoroughly sad, but I know what is right and wrong. No? And your whole dilemma is that whether the child knew at that time whether they were right or wrong. You know? Okay, they became emotional and they engaged in, and JJ Act itself is flawed, I feel, because sometimes children are engaged in a romantic relationship. They may not be 18 yet, but I have had many cases where they have come and they say, "Man, khasna uta mero girlfriend no, isto bhayo anta tyanikin tyo." And then you ascertain it. It looks to be a genuine case, but this is where I think some sort of reformation, something can be taken into account for that also, because especially with, I think, Jwala ma'am, I had a couple of cases from the west and south at one point of time.
Anything you want to clarify? Nothing to clarify now.
तपाईँहरुकै एक्सपिरियन्स भनिदिनुहोस् न अब हैन, have you had interactions with children with abuse and what is the challenge that you are facing, हैन?
Vision.